Wood River Health provides medical, dental, and behavioral health care to over 10,000 people a year, even when they can't afford to pay for the care they need. The cost of providing healthcare services has increased, and the grant funding we receive doesn't fully cover the cost of patient care. We, like other community health centers across the country, count on community support to keep our doors open. With your help, we can keep serving as a safety net for your neighbors. Will you help us invest in our mission?
Good morning. This is DJ Gadget, and I am live here at Wood River Health, and I am with one of my favorite people in the whole wide world, DJ Ken Collins, over here.
Good morning.
Good morning. It has been quite a while since we've been on air together.
I know it has. That's why I had to make sure I come up here to Wood River today.
So I can't
Beautiful morning.
I know. I'm so surprised after yesterday, but I can't ask them because of HIPAA laws. But I can ask you. Are you a patient here?
A dental patient here, yes.
Nice.
Yep.
You got beautiful teeth, so here we go.
These people here do a great job. They really
They do. This was actually the place that, even though I don't live out here, so I'm not a patient here yet. The dentist here was actually somebody who influenced me that it is okay to go to the dentist. But do you want to start off this morning with a little sports report?
Well, I can do a little bit, I guess. I know that we had some baseball games last night. The Yankees are playing St. Louis right now. Red Sox, they get a couple of days off. What's that, good behavior or something?
Yeah, the Red Sox just got a new player,
Well,
catcher,
they
right?
made a big trade. They got the
Alex,
catcher from Baltimore.
Or Adley Rutschman?
Rushman, yep, good job.
Thank you.
They had to give up a couple of young pitchers, but
How much do you think it'll affect them?
well, the Red Sox are in it right now, so they got to go for it. They need a catcher, and this guy here is a switch hitter, and he's a good player, and he'll probably help the Red Sox, especially at Fenway Park when they play.
So Red Sox kind of like depleted their pitcher strength a little bit, but the Padres did strengthen theirs.
Yeah, well, then back to the Red Sox, the pitchers that they traded were minor league pitchers, so who knows what they're going to be. They could turn out to be really good, but you never know what's going to happen there.
Do you want to be really proud of me for knowing what's going on in sports?
Yeah, you're doing good.
So
yeah.
tonight's baseball schedule includes the Dodgers taking on the Cubs, the Giants facing the Rangers, and the Athletics battling the Reds. The Chicago Cubs enter today's action with a record of 64 wins and 49 losses.
There you go. And the Yankees are playing tonight, right? 7 o'clock against St. Louis.
Yep.
And the Red Sox, I think, open up a series with Chicago. That's the Chicago White Sox. I think they're at Fenway. This is all like off the top of our heads.
This was from the hip. This was
which is scary. But, yeah, the Red Sox are in it, and the Yankees got to get some players back that have been injured. So coming down the second half of the season already, hey, it's going to go right to the wire, I think. Looks good.
Very cool. All right.
And we got golf, too. The golf tournament is at the Rocket tournament this week.
Let me guess what time. 4.
And then you also got the NASCAR race, because they didn't race last week. They are at the Iowa Speedway on Sunday at 3 o'clock.
Very cool. Sounds like a few left turns away from a great time.
And the 1864 season for us has ended with the doubleheader the other day.
Oh, yeah?
You should have seen that. That was great.
I should have.
Anyhow, that's a look at sports.
All right. Thank you, Ken Collins. Ben, I don't know how to do a break. Anyway,
I would just say it's time for
we can just go right into it, because that's probably our best bet. I am so excited to be here. I am with Allison Croak, the CEO of Wood River Health, and I am excited to be here as always. Oh, I was already lined up. Look at me go. All right. Hi. Good morning.
Morning. How are you?
That was magic.
Magic.
That was magic.
Is it working?
It is working.
Okay,
yes.
great.
You look great.
Thank you.
And
good to see you.
This is Wood River's Health. Wood River
It's early.
Health.
It's okay.
50th anniversary, isn't
Coffee? Yeah.
it? Do you want to hear a funny story?
Sure.
This has to go on the air.
Okay.
So we all know Krista Paula started this whole relationship with Wood River Health, and I was telling the staff this morning that I am so appreciative that you guys have a appreciation for the quality of the personalities on air, which has led me to be honored to be part of this throughout everything, the library events, this event. I love this event. And so I thought of Chris this morning, and I said, I really want to go to Dunkin'. I'm going to send you a bill. And get my favorite coffee, which we figured out that it's both of our favorite coffees, is a mocha from Dunkin', iced mocha. So I'm like, I'm thinking of Chris, I want to do that. So I go and I'm listening to Apple playlist and random just make noise while I'm driving kind of playlist. Didn't look at it, just push play. And it's playing a bunch of stuff I like, but then I'm waiting for my coffee. I drive up and Steely Dan, which is one of Chris's favorite bands, comes on with Black Cow, which is actually a beverage. And so we used to joke that it was the mocha from Dunkin'. And I was like, hey, buddy.
Oh,
Yeah, it was
that's
really
a great
cool.
story.
It was really, really cool. So, like, I think he's celebrating with us.
I think so. Well, that's a great tribute to Chris,
Yeah,
for sure. Yeah,
yeah.
he definitely helped establish this relationship, and we miss him.
Yeah. And Wood River Health was always one of our favorites because it's kind of a community staple.
Yes.
It is a huge staple.
Yes.
And it recently earned an award.
Yes,
Tell
that's
us
right.
about that.
That's right. So every year, the federal agency that oversees health centers sort of ranks health centers based on their quality. And for the fourth year in a row, we learned this yesterday, hot off the press, we received the Gold Quality Award, which is the highest level quality award you can get. Only 10% of all health centers, there's 1,400 health centers across the U.S., only about 145 of them get the Gold Quality Award. And that's the fourth year in a row for us. So we're really excited. And that's just a testament. You're going to talk to a lot of our staff today. That's a testament to all the work our staff does, from the front desk, the phone room, the physicians, the nurse practitioners, the dentists, the peers, everybody.
And this
Everybody. It's a
definitely
real
isn't
group
your
effort.
first time getting this award.
4 years in a row.
4 years in a row.
Yes, yes. Not easy.
That's
Takes
amazing.
a lot of work.
That
A lot
yeah.
of work
Do you
behind
know
the scenes.
some of the
except-
standards they have, like that makes you excel past others that might not earn that?
Sure.
accolade?
So there's a couple of other health centers in the state that earn the Gold Quality Award. So we're really lucky as a state. Our health centers are really strong and deliver high quality care. So they look at a lot of different things. They look at first our preventive care. How are we taking care of folks in terms of making sure they're getting their preventive screenings? Things like mammograms, colonoscopies. Are people coming in for their annual exams? Are kids getting well child visits? All those things that prevent the bad things from happening. And then when folks get chronic conditions, they also look at how well are we helping patients manage their chronic conditions. So things
sure.
like hypertension, diabetes, depression, that's a big one, anxiety, COPD. So they look at a lot of different things, as well
Very
as there's a couple of dental measures as well for kids.
I was telling Ken this morning, I was like, even though I'm not a patient here, obviously I'm involved here, and the dentists you have here are the ones that convinced me it is okay to go to the dentist. So I made an appointment with my dentist after decades of not going, and it kind of pays homage to like how in tune Wood River Health is with the overall. It's like he could have been like teeth, 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 teeth,
Right.
teeth,
Yes.
but he was like, it is okay to be scared of the dentist.
Yes.
I understand a lot of our patients start out fearful, and I was like, wow, this guy's just a normal guy.
He really is. He really is great. You're right. The dental team is so great. They spend a lot of time educating patients about the right way to brush or the right way to floss, as well as, like you said, just making people feel more comfortable about coming to the dentist, because there is fear. It can be scary.
For sure. Yeah. And it hurts sometimes.
It can.
Sometimes.
It can. Yep.
I just
It's
got a
little
water
awkward,
flosser. I
you know.
cannot wait to tell them.
Oh,
I
they'll
feel
be-
like they're
they'll
going to
be
be proud.
thrilled.
I just
They'll
want
be
to make my
thrilled.
dentist proud.
Flossing is very important. Flossing is important.
So Wood River Health Evolution.
Yes.
You started we're in Hopkinton right now,
We are.
and you also have branches in Westerly.
That's right.
Are there any more? Am I missing
So
any?
we provide the dental care on Block Island. So
And Block Island.
Inside the
I
Block
knew there
Island
was
Health
one
Center.
more, and I was like, I
Yes.
cannot remember, but
Yes.
yeah. So that's a huge jump, and it went from a small community health center to what it is today, which is like a comprehensive, integrated healthcare organization.
Yes.
How do you do that?
Oh, well,
Step
I
by
have,
step.
yes.
We have all day.
For sure. Okay. Well, well, I have to give obviously my predecessors a lot of credit for that. There was certainly a vision, as well as our board, and you'll meet our board chair, Joe, shortly. If you have a group of people that are committed to the organization and to the community and have a vision, it's amazing the things you can do. So like you said, we're celebrating our 50th anniversary. We can't not mention that. That's a big deal for us. So in 1976, a group of local residents got together and said, we need a local healthcare facility. There isn't one here. And there was the Health Center of South County, which was in Wakefield. It's still there today. It's Thunder Mist Health Center, their Wakefield site. But, the folks, how Rhode Islanders are. That's over half an hour away.
I was thinking of that today on the way here because I live in
Yes.
Connecticut.
Yeah.
And
Yes.
I was like, I put you in the GPS, as I always do, because I couldn't find my way out of a wet paper bag. And it was only like 30 minutes. And I'm like, wait. No, I'm going to Hopkinton. I'm not going to Westerly. I'm going to Hopkinton. I know Westerly's closer to me. And I'm like, this is so close. I had to check 3 times. I'm like, am I going to the Westerly
Yeah.
one? Because that's not where they are.
Oh, it's right off the highway too,
Right.
which is also very helpful.
So yeah, it's very Rhode Island friendly because there's not much traveling to get to either location.
That's true.
Maybe Block Island, but you can take a ferry.
You do. And on a day like today, what a perfect day to go to Block Island.
So beautiful.
So the group of local residents got together, said we'd like to form this healthcare organization. And if you look at the Articles of Incorporation, they're folks that lived locally. And so they created the health center in 1976. And then we moved to this land in 1982. It was gifted to the nonprofit. This land, as well as Canachet, started around the same time. And from there, we built and added on as we grew staff and the number of patients grew and the need grew. So today, this facility is about 20,000 square feet. And like you said, provides primary care, dental care, integrated behavioral health, including substance use treatment, as well as we have the WIC program here. We have a physical therapy provider that we rent space to. We have a pharmacy. We have a lab, and we have about 100 staff. So and some days it doesn't feel like enough to meet all the need, but our staff works really hard to do that
I
and
feel
cares
like you
about
guys
our
have
patients.
been very adaptive through everything. So it's like the need is basically the foundation of how Wood River was created at all. So as more needs come, I'm just imagining you're going to get bigger and bigger.
Yes, we'll see. We'll see. We're
Allison's
gonna.
like, and I am going to take a lot of Tylenol. My head hurts.
One of the sort of barriers to us growing more in a way that we would like to is really the primary care crisis that I know we all talk about.
Yep.
It has become harder for us to both recruit and retain primary care physicians, nurse practitioners, physician assistants. Everybody feels that, right?
Yeah.
I mean, folks move into this area. I've met so many people that moved here from other places, and they say, I have to wait a year, 18 months to get an appointment or even get in anywhere. I'm on a wait list somewhere.
Oh, yeah.
And the struggle is real. We're not making it up when we say there's a primary care crisis. It's very challenging. We have several open positions. So,
I was going to say, is it
plug.
safe to say that
Yep,
you're
plug.
hiring?
We have a position open. We're trying to hire a family medicine physician, and we have 2 positions open for what we refer to as mid-level providers, nurse practitioners, or physician assistants. So 3, and that would really help us to meet the continued need.
I'm going to pivot a little bit. Say I was a qualified physician of any sort, do you think it's attractive to work for somebody who's like federally qualified? Because Wood River Health is a federally qualified health center.
Yes.
Does that differ from working at Dr. Smith's clinic?
It does. It does. It's really different. I mean, the people that work here have a passion for community health, so it helps if you have a passion for community health. It's not the same as working at a private practice. In many ways, there's a lot more supports than a private practice. So when I mention, like, we have the dental, practice, we have integrated behavioral health, because patients come in and have all kinds of things going on. They might show up for what it says in your schedule. They're showing up for a sick visit today,
Yeah, but really,
but they
broke it
really
too.
have other stuff going on. They're
Yeah.
very anxious, or they're struggling with maybe some housing issues, and we have resources here that can help
Stress.
support. Yes,
Just the
stress.
stress could make you sick.
Yes, the stress
just-
of the economy,
Yep.
the job market, all of it, and people need help and need to know that there's a place that they can go. So, for in a private practice, you're kind of alone in that. You're feeling like you
Right.
have to manage all of this by yourself. But here, our primary care providers can just call in one of their colleagues and say, I think, it would be great if you talk to this, colleague of mine about, what you just told me. So those supports are there. We also have some recruitment tools that are at our disposal for federally qualified health centers. One is loan repayment. So there are some folks that that have federal loans that can apply for and get loan repayment. And it's not just the physicians, nurse practitioners, dentists. We've had behavioral health clinicians, RNs that have
So it's
done
like
loan repayment.
you obviously already went to school.
Yes.
Because usually employers will be like, "Oh, further your education and we'll pay for it." But this is like hindsight.
Yes.
That's great.
Yes.
That's fantastic.
So that's a real benefit. But also, like I mentioned, you have to have the passion for community health. Our patients can be very complex. I mean, humans are complicated,
Humans
right?
are
We don't just
so-
have one thing.
That was the nicest way I ever heard it said, Allison.
Oh, well, there you go. So we, I always say to physicians when we meet them, and I think this is just healthcare in general, if you're looking for a place where you're going to tell your patient what to do and they're going to do everything you say, this isn't the place, right? I don't know where that place is, because I
wanna know where that place is.
I don't always follow my doctor's advice. I try. But, I think that for our providers, they know that, and they're very patient and non-judgmental, and they treat our patients with respect. And they're, like I said, they're really passionate about it. And many live in the local community.
That kind of reminds me of my favorite quote, which is, "If you love what you do, you'll never work a day in your life."
Yes.
And I do a lot of things in my life, but when I'm on the air doing stuff like this, I'm actually having a lot of fun. Like, it doesn't feel like work.
Yeah.
I'm doing a thing before work today is how I
Right,
kind of feel,
right.
because I have to go to work after this. And I'm like, oh, but I want to stay here. We have lots
It's
of
a
cool
nice thing to
stuff
be
here
here.
too.
Yes.
These awesome colored 50th anniversary
Yes.
Wood River Health pens. So I should be taking notes, right? Like,
It's all right. I think this is being recorded. You can always refer
that's
back.
True. That's
Yes.
true. And I was just thinking about like integrated care
Mm-hmm.
and bringing together everything. What do you think is the biggest claim to fame here at Wood River Health? Like, what do you think is the draw for like a patient?
So I think that what we mentioned earlier about the quality awards, I think there's a lot of myths about health centers, right? So one of the myths is that now, and some of these myths kind of stem from our original roots. So health centers and the health center movement celebrated 60 years last year in 2025.
Oh wow, you guys were kind of like at the cusp.
We were right at the beginning.
Like,
Yes, one of the early,
ground
one
up.
of the early ones. The health center movement started as part of the civil rights movement. And when you think about what was happening in the country in 1965, we didn't have Medicare, we didn't have Medicaid. Those were brand new programs. So up until that point, a thing like Medicare, which seniors, they cherish Medicare, right? I mean, the whole
Right.
country does, right?
It
If there's-
kind of like that's your staple. That's your you have to get on
Yes.
Medicare in order to survive.
like the
It's a
gold card,
survival
right?
tactic, yeah.
But
for sure.
prior to 1965, that program did not exist. So there were parts of the U.S., and there still are, so don't get me wrong, but there are parts of the U.S. that had no usual source of care. Urban areas, rural areas, nowhere for them to go to access health care. So health centers were created to address that need, and often were first established in low-income communities. So from there, the movement grew, right? And so today, yes, we serve low-income patients, but we serve all patients. So one of the myths is that you have to be lower income to come to a health center, or that we're a free clinic.
It's
And
wildly different today.
very, very different, right? So 40% or more of our patients have commercial coverage, commercial insurance. 20% of our patients have Medicare coverage, and about 40% are Medicaid beneficiaries, so low income as a, because of that. So that's
Does
one of
anybody
the
have no insurance?
that's another reason to come here, right? Is if you don't have insurance, we will accept you regardless of your ability to pay, and we don't turn anyone away. Right,
Okay.
so if you come today and you don't have your copay, for example, you're like, I had to put gas in my car.
There's
right?
no reason to not miss your appointment.
That's
There's
right.
no reason
That's
to
right.
not get your meds
That's
refilled
right.
or whatever.
That's right.
Okay.
Absolutely, absolutely. So that's a real draw and benefit. There are some changes coming to the Medicaid program. HR 1, sometimes we refer to it as the Big Beautiful Bill, did introduce some changes to healthcare
Good
coverage.
changes?
My perspective and our perspective is that no, they're not good changes.
I was hoping.
Well, I know. There's always some, and I can talk a little bit about the Rural Health Grant. That is one aspect of the Big Beautiful Bill, or HR 1, that will really benefit our area.
Okay.
But Medicaid beneficiaries are going to have some changes. They have to demonstrate work requirements, that they're working, and they have to recertify more frequently. It does create a little bit more red tape and bureaucracy that could cause people to lose their coverage for a period of time. But they can still come here. I mean, that's what's great about here.
And do you have people here? So say this is very confusing. I have no
It is
idea how
very
to get
confusing.
insurance. I've tried and tried it.
Oh,
It's
well,
really,
we have
really hard.
navigators. I told you. You
I
can talk to one of
know.
our navigators.
It's just like, what if I need to come, like, what if I just need help? What if I'm not coming here? I'm not sick. I'm fine. But, like, also I'm nervous about health insurance. I don't know how to do it. What is open enrollment? What does that mean?
Yep.
Stuff like that. Can I come here to maybe find somebody to help? Do you have, like, an office staff that will be,
do.
like, exactly all about that?
So we have people who are trained as insurance navigators. That's what we call them. And that's what they do. They help people navigate that system because it's very, very complicated. Even if you know what you're doing, it can be very, very overwhelming. So, and you don't have to be a patient here to access the navigator. You can just call, make an appointment. They do a lot virtually, so you don't have to come in necessarily.
Oh, that's awesome. So transportation is not
That's right.
an issue.
They can help people over the phone or over video. They also meet people in the community, and we do community events. So we go out during open enrollment. We might go set up a table at the Johnny Cake Center, for example, and have walk-ups, walk-ins, help people to sign
cool.
up.
So you don't just do your own events; you go to others as well.
We do.
You are
we
a
do.
busy
We colla-
lady.
Yes, well, it's not just me.
Yeah,
It's
I
not just
know.
me. We have a team, right?
No way. I love your team. Your
we have
team
a great
is like
team.
everybody. Like everybody is just so. I was just talking about this morning. I'm like, it's somewhere like if you're sad, just come here because like somebody here is gonna make your day, and you can still talk about why you're sad,
Yes,
but you're gonna
you
feel
should.
better about it eventually anyway because like everybody here is so. It's the difference between liking your job. So that's that passion you were talking about, going back to that, and not liking your job. Even if you go to a coffee shop
Yes.
and somebody doesn't want to be there, they don't
Yes,
want to be
you
a
can tell.
barista, and they're like,
can tell.
"Hi, can I take your order?" All right, drive up.
Yes,
Versus, "Good morning, how can I help you?" And you're like, "Ooh, that was fun."
for sure. For sure. Yes, and it
I
starts
think
at
that-
the front desk.
That
right?
feels like Wood River Health, like the "Good morning, how can I help you?" and the empathy and everything that it means to be a good human
Yes,
lives here.
that's what
I
we're
love
going
that.
for.
And that's your mission, providing high quality care despite insurance or ability to pay, insurance status, transportation. I know you guys
Yes,
have
yes.
a MediRide program
We
as
do.
well.
I'm looking right at our van. So we, when we ask patients questions about things they need, like do you have enough food, is your housing stable? The biggest need that our patients tell us is that they don't have is transportation. So we don't want that to be a barrier to getting your medical care, your dental care. So we, with some grant money, we purchased a van. We have a part-time driver, also funded through some grant dollars, and he picks our patients up and brings them here or to Westerly. He sometimes will also bring them to other appointments. If he's got time in his day, he can pick someone up and say, "Oh, I've got I've got a prescription I gotta get." He'll drive folks to pick that up. Sometimes drive folks to get their, X-rays, mammograms, things like that, depending on what his day looks like.
They should know that you have a pharmacy right here.
We do. We do have a pharmacy right here.
Do you guys deliver for the pharmacy? Does the pharmacy deliver?
Genoa Pharmacy does deliver. Yep, they do blister packing for folks, which can help people just stay organized about their medications.
I'm really bad at
especially if you're on a
organization
lot
of
of meds.
medications.
And it can be it's important, right? There's certain medications you have to take at certain times of the day, or with food or not with food. And so they do a lot of education, and they do the home delivery.
That's awesome. Going back to the primary care crisis, it's not
Yes.
just hiring that's the crisis. Is your staff experiencing any sort of burnout, or what does River Health do to mitigate that? Like work-life ratio, what's happening there?
Yeah, so that's tough. Yes, so we definitely experienced burnout during COVID, but coming out of COVID, I think we all thought that in this post-COVID world, things would be easier. They haven't gotten easier.
Still waiting.
Yes, we're still waiting. So I think the world just has changed pretty fundamentally.
It definitely has. Like I'm an employer too. Like I own a business, and one of my staff went home the other day sick, and I was like, told my wife, I was like, he needs a doctor's note before he can come back. And she's like, I don't know if we can force that. I'm like, in a post-COVID world, I don't care.
Yeah.
I don't care. I want to know he's okay. I want to know he took the tests he needs to take to make sure he's not going to give everybody COVID or anything worse if that even exists. So
Right.
I'm like scared that it's my staff's safety, their family's safety. That's all on me. So like I'm like, he needs to be okay before he comes back. I don't want anyone coming to work sick. But before, the work ethic, strap up the
Yes,
bootstraps
that's
and
right.
go to
come
work
to
sick.
Come to work whether you're
And
sick or
now
not.
it's
for sure.
terrifying.
Yes, for sure, for sure. So a lot of different things can cause burnout. Certainly, the hours that providers work. We do strive for that. I don't think people use the word work-life balance anymore. I've heard work-life integration because I think it's to achieve a balance is probably not realistic.
I'm a dreamer.
Yes, we can dream. We can dream. So we give generous paid time off, holidays. We encourage staff, take the time, plan for it, but
Yep.
take the time you need. So that is one way we address it. There are some practices that want people to see, 20, 25 patients a day. That's not what we're looking to do. Although, that is how we generate
I bet
our
you some
reimbursement.
days are a little
So
bit worse than others, where
yes.
because you want to see all the patients.
Yes.
So if there's 20, 25 in your parking lot, I got here. This parking lot was empty.
Right.
And I got here at like 6 something, and I was a little bit nervous. I'm like, wait, I was supposed to come here, right? Staff parks and back. So there's
Yes.
there's no parking lot here that is full of staff cars. It is getting full.
Yes,
So
yes, that's
I
right.
love that. I love seeing that the community feels safe here, comes here, finds value here. Plenty of handicap parking. I love that too.
yes, yes.
And really, really just integrated and adaptive
Yeah,
environment to be
yeah,
in.
for sure. And the other things that we talk about in terms of, the primary care crisis and burnout, you've probably been to the doctor, we all have electronic medical records now.
Right.
So providers, spend a lot of time like looking at their computer, not looking at their patients. So
Right.
one of the things that we got some grant money initially to do this, we purchased a scribe, an AI scribe. So the provider can look at you and talk to you and look
And
you in the
whole
face.
conversation is being written for.
Yes, and they're
How
writing,
cool
so
is
the note is
that?
being written for them. They just have to review it
That's
and
true,
then
'cause
put it right into the charts. So-
Sometimes they're typing and I stop talking because I'm like, give them a minute.
Yes,
And they're like,
yes.
anything else? Or they just move on because they think I'm done.
Yes, so they that has definitely shaved hours off their time every day that they were spending extra above and beyond. But providers, primary care providers, they're still, we try really hard to not create situations where providers have to take work home, but they're taking work home, and the burden of the administrative burden, the electronic medical record, as well as other things, insurance requirements, for example, it really can't be overlooked. It can cause a lot of burnout. And primary care providers in particular, you're supposed to be a one-stop shop. Every time you leave the hospital, you go to the emergency room, what do they say? Follow up with your PCP.
Yeah.
So,
And I was like, I don't have one. Stop it.
right. But
I
for
had
those
one.
that
She
do,
disappeared. I fear that she was actually a victim of primary care, like burnout.
Yes.
Because she disappeared. And nobody believed me. They thought I just didn't have a doctor. So I went to like an urgent care or something, and they're like, oh, follow up. And I'm like, I don't have one. And they're like, you put down this for your thing. I'm like, yeah, but she's gone. She disappeared. I don't know
Yeah,
where
no,
she
it's-
is.
it's very
And they're
possible.
like, yeah, okay. And I'm like, and then like a year or two later, it was known that she disappeared because all her patients said like, I don't know
Yes.
where she is.
Oh, wow.
And it's sad.
Yeah.
And so they
It's-
believed me finally, but I still had to wait that year for people to be like, oh yeah, she really.
Which is a long time to go without a
Yeah.
primary care provider, and that's part of the challenge as well, is that in the post-COVID world, people really delayed care during COVID. So now when the patients come in, they're more complicated, their issues are more complex,
Right.
and the PCPs tell me that half or more of the patients that come in every day have some sort of behavioral health or social determinant issue. And that can really create, we use the term moral injury, when a provider is hearing a patient say something and they're not trained to deal with it, or they feel like there's nothing they can do to help the person. So that causes burnout. When you go to your, not to pick on like orthopedists or whatever, right? But if you go to your ortho provider, you're just talking about the pain in your knee, right?
Right.
You're not telling them, oh, by the way, I think I'm going to lose my apartment.
Because
Whereas
I
we're,
can't get around and I'm not
Right.
doing what I used to, and
Right.
also I'm sad about it.
yes.
And also, I
Yes.
stayed in bed and I haven't brushed my teeth in 3 days. Yeah, it's
So
all connected.
yes, it definitely is. So
Yeah.
that definitely causes burnout. But like I said, that's a primary care industry wide issue. There's not enough people coming out of medical school or coming out of nurse practitioner or PA school that want to go into primary care.
Yeah.
So that's that burden then falls on the people that are still there. So we've had a couple providers leave and take positions elsewhere, but the patients are still our patients.
Right.
So now we've got fewer staff trying to take care of the same number of patients, refill their prescriptions, get them in for sick visits. So it's tough. It's really tough. And I think just acknowledging that is important, so that people know, no, I hear you, I see you. I don't have a magic bullet, a perfect solution. I think it's going to take a lot of time and a lot of really smart folks getting together and working collaboratively to try to fix it. But we've got to really focus on fixing it.
Yeah. I know you guys are expanding a little bit. Tell me a little bit about Tower Street and what's going on there.
Yes. So we're very excited about the Tower Street project. So for folks that aren't aware, Tower Street School was turned into a community center
Yep.
in the early 2000s, because school enrollment, births are down in the state, wasn't needed as a school anymore.
I've been to a few job fairs there.
Yes, it was a great community space.
Yep.
Then COVID, right? So it closed completely.
Mm-hmm.
And then by say 22, 23, it wasn't maintained, and it wasn't in great shape to begin with. So the building itself was just really ready for demolition. So rather than the town just selling to a developer, a group of concerned citizens got together, led by Chuck Royce and the Royce Family Fund, and did a community needs assessment and said, well, if we were to tear this down, what should we put in its place? What does the community need? And rising to the top of those needs was healthcare.
Of course, yeah.
As well as workforce training and some other things. So based on that community needs assessment and what the community needed, the group started to raise some funds, and we built the building. So we're continuing to raise money. It's not as big as we originally envisioned. The original vision was a $35 million project, and lots of different levels, first floor, second floor. So we were somewhat, it's hard to raise money, right?
Yeah.
But we did raise what we could, and inside of the new Tower Street facility, we've got a space for ourselves where we'll have primary care and our behavioral health space as well. Westfield Education Center will have space in there. They're going to do primarily healthcare workforce training.
Okay.
So we need medical assistants, we
Yeah.
need dental assistants, so they help with all of that.
Kind of like tearing down the barriers of the how-to.
Yes.
Yeah.
And the town also has space, so the town recreation department in particular.
Nice.
There'll be just open community space for any member of the community to come in. They need to hook up to the Wi-Fi or whatever it is. There'll be a navigator there,
Nice.
right there at a desk to help anyone that walks in. There's private space for folks to have telehealth visits, not necessarily with us, but they could have telehealth
But if they don't
with a
have a
different
computer
provider.
and they don't have a
Or
car, how
Wi-Fi
are they gonna
access.
do their telehealth visit?
That's
yeah.
right. That's right. So, so we're really excited, and once the building, we got slowed down a little bit. There was a lot of snow this winter. Too much snow. So February was a tough month. So we got a little behind, but our contractor AZ Corp, they really caught up, And we are looking like it's going to be mostly finished by the end of September. And we'll start to occupy the building in the October timeframe. So we're really, not sure that's when we'll move in, but folks will start to move in
love that.
October, which
That's
is
just
really
like-
soon. It's already the 4th
I mean,
of August.
We're talking this year, so I
This
mean,
year.
things are moving
Yes.
forward, and that's super
Yes.
exciting.
Yes.
Speaking of moving
Oh,
forward,
yes.
um,
It is time. I
looking
think,
ahead though,
yes.
building on the next 50 years of service, what do you
Yes.
think? How is Wood River Health amping up for the next generation?
So as I mentioned earlier, we're recruiting. We need providers. We're recruiting providers that not only can see younger patients, but also older adults. Our community is aging. So I mentioned births are down. People aren't, family size is smaller. So we definitely are looking for providers that can help with issues for older adults, all of us. So I'm doing it kicking and screaming. We're all getting older. It's a fact of life.
Not this guy.
No. So,
This guy's gonna stay young forever.
so we're looking at, what do we currently provide and how do we just do more of what we already do well?
Sure. Thank you so
Yeah,
much.
thanks for having me. This was great. And
Yeah,
thanks for being here.
I love this event, and you get swag.
Yes, we definitely get swag.
Yeah. So
And what a beautiful day to be outside. All
I
right, so I'm going
know.
to invite Dr. Manlove over, right?
Yes,
I think we have
please.
Dr. Manlove and Sharon McGinnis. I'll be right back.
All right. So if you want to come down, they have a whole table set up. You can get swag. Are you gonna get swag before you leave? If you need stuff, there's a hand sanitizer, and that has a carabiner. I don't know how to get that out of the bag with one hand. What is this? This is a pill case. The drugs are not included. A flashlight.
Wow.
I didn't know
Wow.
if you were there still, so I was
Of
like,
course I'm here. We're going to go to a quick break and we'll be
okay,
right
go to a
back.
quick break. I'm gonna play with my stuff.
Wood River Health provides medical, dental, and behavioral health care to over 10,000 people a year, even when they can't afford to pay for the care they need. The cost of providing healthcare services has increased, and the grant funding we receive doesn't fully cover the cost of patient care. We, like other community health centers across the country, count on community support to keep our doors open. With your help, we can keep serving as a safety net for your neighbors. Will you help us invest in our mission?
At Lathrop Insurance, our core values guide everything we do because insurance is more than a policy, it is a promise. We care. We treat every client like family. We're solutions driven. We find answers, not excuses. We utilize teamwork. We do what we say because integrity matters, always. And we're always growing. We strive to be better today than we were yesterday. These values have shaped 86 years of service to Rhode Island families and businesses.
Experience local excellence with Roof Right Roofing in Charlestown, Rhode Island. With over 40 years of unmatched expertise, Roof Right specializes in architectural shingles and holds the prestigious title of GAF Master Elite Installers. Known for their commitment to the community and support for local initiatives, Roof Right is your trusted partner for all of your home's roofing needs. Call today for a free estimate at 401-212-4140.
321 is about so much more than sports. We're about community, family, small businesses, nonprofits, and sharing stories that deserve to be heard. 321, what's your story?
And we're back. All right, so this is, y'all missed it, and I'm so sorry, because that would have probably been YouTube gold, but you can get a fan. I love that. It did surprise me. Anyway, I am here live. I'm DJ Gadget for 321 Media and Beyond, and this is Dr. Lisa Menard Menlove, and Chief Medical Officer, and Sharon McGinnis, Peer Recovery Specialist Supervisor. Let's start. What does that mean? Both of you. What is your job here?
Okay, so I am newly the Chief Medical Officer, which is a more administrative position where I am helping to coordinate care with all of the healthcare providers here and hopefully, get us moving, better care for the entire community. I'm a family physician. I've been here for 23 years, so a lot of experience with the health center and with the community.
We're going to get back to that.
Mm.
But what is a peer recovery specialist supervisor?
So first, I'm a certified peer recovery specialist. So that means that I'm a person with lived experience, and I've gone through a training, and I have a lot of hours behind me with connecting with folks who have either a behavioral health need in mental health or substance use. And as a supervisor, I am now also trained to be able to lead other peers to learn those skills. And here we have a full-time peer, and we have 2 peer interns on our team. So,
Wow.
Yeah.
The recoveries department is expanding faster than anyone else.
It is.
I'm proud to say I'm 6 years sober as of
Fantastic.
last month. And I've used a few services that you guys probably work with that just, they help a lot. One's Marigold.
Yes.
That's a peer recovery specialist. But the only reason why I ask stuff like that is before that, I never heard of peer recovery. I'm like, what does that mean? And it means that I know what you're going through because I went through it too. So I don't even remember what age I started using substances, but when I said enough was enough,
Right.
I made the decision, and it was not easy. I don't know how else to describe that. Dr. Menard Manlove,
Man loves fun.
what drew you to Wood River Health? Was it that it was like a federally qualified health center? Was it something else?
Yeah, I mean, I always knew I wanted to work in a community health center because we treat everybody the same, right? We treat all comers, and you never know what's coming next, which is why I love family medicine.
Fair.
I could go from somebody who's elderly to a newborn baby to whatever else hits me during the day. But in a community health center, we have a mission to take care of people who might not otherwise get their care. The other reason I really like working here is we don't know why you're coming in the door. Right? You're in our waiting room. You could be here for medical, dental, behavioral health, substance use treatment. There's
It's a
no
heck of a surprise party.
there's no judgment when you come in the door here.
Yeah. How does the model that Wood River uses, the whole integrated care, dental health, how does that look in your department?
So what we practice here is something called patient-centered medical home, or PCMH. That means it's not the old-fashioned model where, you know, the doctor tells you what to do,
Right.
but it's really the patient at the center of that, and they're seeing me for their medical needs. But I'm working very close with the behavioral health specialists, with peer recovery, with dental, to really take care of the needs of the entire patient. You know, there are so many social integrations with how our health is. And we have community resources. So if you can't put food on the table, it's really hard to take care of yourself with your
Eat
medical
healthy.
care.
Okay, but I don't eat.
Right.
Because
Right.
I
So
don't
if-
have anything to
So
eat.
I think that's a unique feature of a community health center, right?
that is awesome.
It's not you're just coming in and getting one thing. You're coming in and we can truly meet your needs.
And the big benefit of being here is probably I was one of the people who was like, I don't want to go to another doctor to tell me to stop drinking because they don't know their
And you know,
foot
insurance
from their elbow.
Sharon's a big part of
Yeah.
that, right?
So I think it's very nice to be able to be like, how about we try something new? Do you encounter people who are like, you're probably lying, or you're probably just a doctor in disguise, or
So
there's
our-
a fear. I
our-
know there's a
right.
fear.
Our approach, though, is to come in as a peer, to come
Okay.
in as someone who's going to provide support, provide some guidance, provide some options. But we're also going to meet the person where they're at. And
Mhm.
that is a part of that harm reduction model. So here with the integrated care teams, the patient comes in, and it can be for dental or for medical, and that provider will outreach us and say, do you have a minute to come and speak to this person? And so we just ask them what's going on. Tell us a little bit about yourself. And as they share some things, and we say, well, can we share a little bit about, you know, our experience with something similar? And these are some options out there. Often folks are leery of change because change is scary. And so we'll offer to meet them at places. So we'll offer to go to the hospital with them, to go to the detox with them, to go to court with them. We'll offer
That's
to do a lot of these types of very scary and overwhelming places with them. And even just our presence, just sitting there, we don't really have to do a lot. Just being there, they look over at us and then they feel confident to advocate for themselves. So that's what we're there for, not only for our own advocacy, but to help that other person advocate for their needs.
That's awesome. Do you think some of the peer support people, can they be affected? Like there's burnout, there's provider burnout all day long, but I'm thinking when you're doing something like this, like, I don't know if I would be ready for it. Even 6 years in, I'm like, I don't know if I can hear those stories about being in the scene or this or that and not get triggered in some way that makes me miss it or makes me.
So I think that's really where a team approach works really well. So I can be in there with a patient and, talking about their healthcare and, they're finally ready to talk about their substance use. And I can say, look, I've got somebody who is a peer recovery specialist, has the experience. They're going to be able to talk to you in a different way than I can. Right. So that's part of the team approach. I can call Sharon in and be like, here's the situation. Maybe they're not ready, but now they know they have a resource.
And like, will you help them make that decision, or if they are ready or if they aren't ready, or what you believe is the next best step or options?
Yeah. So I make my recommendations, right? And it's always the patient who is going to be the person who makes that decision, but we empower them.
Nice.
We empower them and it also empower them that, look, if you're not ready today, we're here.
Does peer support cost anything? Is it covered by insurance?
So here under the integrated care model as well, we're just a part of the conversation. So there is no additional fees. There are peer recovery centers, and so they do go through a process here. They just get to meet with myself or my other peer, Alex, and we'll have conversations with them, which also include, if they're not ready yet today, we ask, can we check in with you next week? And so we'll call individuals on a weekly or biweekly basis. We give them our information and we let them know whatever it is that they want to navigate. We're here to help with navigating that process.
Nice. Do you guys do events or anything? Do you have any events coming up?
We are all over the place. And one of the things I'm really excited to talk about is, for those who are familiar with the recovery community, Providence has been holding a rally every September for many years now. And East Bay started one a few years ago. Well, starting in this September, on September 12th, there'll be a rally for recovery in Washington County at URI. Yes. So
I almost threw my pen and I don't know why.
So,
it almost threw itself.
Exactly. So I'm so excited that I'm working with a really great group of folks in the area, both here at Wood River Health and with the Healthy Bodies, Healthy Minds in Washington County and with URI to bring this event together. To date, we have over 25 vendors who have signed up for a table. We're going to have music. We're going to have the resources. We're going to have fun events going on there. There'll be family-friendly things going on. So speaking of the Rally for Recovery, if somebody is still interested in a vendor table, we still have that open so they can check out that on the website.
On Wood River Health's
Correct.
website?
So I don't know if this will be visible to folks, but we do have
but
a
I'm
flyer.
going to post a picture. I'm going to take
Excellent.
a picture of that too. And
But yeah, we do encourage
a rally. Oh, I'm so excited. That I kind of saw a poster and I was like, maybe that's an event. I don't know, but I can't see that far. But I wasn't expecting that. I've been to like sobriety rallies, stuff like that before, and I can't even begin to explain how empowering it is to look around and be like, we've all been through the crud and we're all here. And it's almost like if you don't feel it at all day to day, you'll have that moment where you're like, this is worth being alive.
Exactly.
We're one of those days where you're on a high without getting high. It's so cool. If you're a survivor, if you just want to go, if you've never used in your life and you don't know anyone who used, you still live in a community. You're going to find things there like personal Narcans to carry around with you. I have Narcan in my shop that I own, usually in my backpack in my car. I just carry it around with me. One of my friends saved somebody's life with it. Stuff like that, CPR masks.
Yeah, so
it's amazing.
We're empowering people, not for all parts of their healthcare, right? making their own decisions, but we're guiding them not only with, hey, there's a medication that you should be taking, or getting them to counseling or dental. It's really about the whole person.
Yeah. And this proves it, like, to community events from your community wellness center is really, really cool. And there's music and food and family fun and resources. I love rallies. I love anything that brings a community of like-minded people together, because it fuels why you're doing what you're doing. Allison was talking a lot about having passion for what you do. How do you mitigate burnout? How do you keep the passion alive in what you do? And is it hard?
Oh, yes. We know that there's a huge amount of burnout in healthcare. It's just becoming a very difficult system to navigate. So we're really working on building the primary care workforce and, getting balance. We all need balance in our lives. So how do you, strive to really help patients, but also taking into account we need to take care of ourselves as healthcare professionals. I think we can all acknowledge that primary care is in crisis right now, especially in our state. So we've been working with the state and federal legislators to help improve access and increase the knowledge of the importance of primary care. And we've definitely made some progress here in the state, but this is a long-term process. We know that primary care, we are the gatekeepers. We are the entrance into medical care for patients. And we also know that for, every person who has a primary care physician, we're helping keep them out of the emergency room, hopefully keeping them out of the hospital with complications. So in the end, it's better for our community. It's better for our healthcare, but it's also cost saving, right?
Right.
And that's, I think, where some of the systems that are in place kind of lose sight. Is not only is it better for society to have a healthier society, but it's also less expensive.
Yeah, seriously, preventative care is probably
it's key.
Yeah.
It is definitely the cornerstone of our health.
It's like healthy eating, exercising,
Mhm.
preventative care.
Yep.
There's obviously forces everywhere, red tape,
Mhm.
glass ceilings, all that. But why is Wood River Health a different environment? I hear no judgment. Oh, we listen and we do not judge.
Mhm.
Why? Why do you not judge? Wouldn't it be easier to say, well, you need to eat healthy? Well, it's because you smoke. Well, it's
Right.
because of this. Because technically, you probably know in some scenarios, it's because you're doing this. This is your fault. How do you present that
So-
as a non-judgment?
Right.
Or-
So it's, again, what Sharon said is meeting people where they're at.
Okay.
Maybe someone doesn't understand what a healthy diet is. Maybe they don't have access to healthy food. That's what we call the upstream approach.
Okay.
So I like the model of you're in a river, you've got the dam, right? Our healthcare system is really good about catching people after they fall in.
I love that.
So in primary care, we're up above the dam.
Okay.
We're trying to catch people before they go over the dam. And then we have the societal factors that are even further upstream, putting in place healthy eating habits, putting in place the ability to exercise.
So you can still eat what you eat, but maybe try this once. One
Yeah,
glass
or-
of water a day.
Right. That's
Maybe
the
it turns into
individual.
two.
That's for
Yeah.
the individual. How do we take it even further
Okay.
to our community?
Right. Access to grocery stores or healthy foods.
Right.
Or...
So you have the access. We talked about the community resources. We talked about, peer recovery, behavioral health, giving people all the tools that they need to be successful in a healthier
Right.
life.
that makes sense. I own an auto shop. That's the shop I own. So if I turn around to my toolbox and something's not there, now I'm stuck and I have to either go get it or order it or see if it's even available to me.
Right. Yes, that's a good analogy.
Yeah. So that makes a lot of sense. Anything else?
Well, and as peers, when we come in, we're out in the community. And one of the things that I am a big supporter of is getting out into the community and meeting those that can provide these services. So when we meet with folks, if they do have, say, a food insecurity, we can tell them that we know somebody at a pantry. Would they like us to introduce them? Would they like us to go with them? So these are things that can, again, help decrease that barrier. And one of the other great things here at Wood River Health is we have 2 transportation vans, and the smaller one, the peer recovery specialists have access to on Tuesdays.
Nice.
So if somebody needed transportation somewhere, we're able to provide that too. Again, trying to, with that no judgment, yes, we're going to point out facts, but we're going to try to do it without increasing shame, with increasing the embarrassment. Certainly, smoking is unhealthy for you, but can we talk about some options that you're open to for being healthier? So not saying, well, your smoking is going to cause lung cancer, but just, okay, we can agree smoking is unhealthy. What can we do to move forward with that? And so that's, again, it's the language. We're choosing different ways of bringing that subject up, and hopefully that person, it feels in control to choose an option that helps their life get healthier.
For sure. As a patient, it's just like you hear it all. And I used to smoke, so it was all because I smoked. So then I quit smoking, and then it was all because I drank. And then I quit drinking, and then it was all because I did drugs. And then I stopped drugs, and then it was all because I was fat. And then I lost weight. And it's like, what is it now? Like,
People know what they're doing is not.
nobody smokes a
for them.
cigarette because they're like, no, I was taught this is totally
So
healthy.
people know what they're doing in terms of their habits are not the right thing to do. But how helpful is it for me to say,
It's just
hey,
frustrating.
You're smoking, you shouldn't be smoking, that's causing all your problems. You're smoking, we know that this is not a healthy habit. We know that this is, not helping your lungs. You can't breathe very well. But where do we go from there?
It's kind of like that campaign where like it was brought to light in recent news and everything, and movements of people telling women to smile. Oh my God, where have you been all my life? Thank you. You've solved all my problems.
I haven't heard that. But
Like it was just a smile, or dealing with invisible disabilities like depression, which can very well be, there's masking, it's invisible, being like, well, if you smile for 7 minutes a day, it increases your dopamine, blah blah blah. Oh well, now I'm cured.
I don't know. She seems like somebody who smiles.
I smile all the time.
I'm a morning person, and then my meds wear off. But no, I love this. I love peer recovery. I love that I met you both. And is there anything you want to? What would you say to people out there that aren't patients? And if you want, you can say hi to your patients too. But that aren't patients, that are like, is Wood River Health right for me?
Yeah, I think right now, building up the healthcare force and building up primary care is really important, because we know there is such a need. So that's where we are right now. I would also encourage, whether you're patient or not, speak up to the local, state, and federal legislators of how important primary care is and why. Because all community health centers are struggling right now. And it's very clear from our discussion that we need more healthcare like this. We need more primary care. We need more. We need to have more of the ability to treat the whole patient and not just part of them.
I agree. I totally agree.
And I would also concur that right now we need the support. And so within peer recovery specialists, we're about advocacy, and advocacy includes the systems advocacy. So I do encourage people to reach out to their representatives, to get involved in any community organizations that are trying to bring awareness around this, that we all deserve primary care. We all deserve to be treated with respect. We all deserve to get these things, but it's going to happen because we come together and we ask for it, and we expect it.
Right. I don't think they can say this, but they're saying, go vote.
Vote right to your
but vote to
Be a
benefit
voice.
yourself. Like the popular opinion, what this person wants, that person wants, is not important. The important thing is to always advocate for yourself. And I think Wood River Health is a place that you hear that all the time. Oh, I don't know how to advocate for myself in front of my doctor. Here you have peer support who can. Would you go to a doctor's appointment with a patient if they asked for you to?
Yes, we do.
And are they allowed to?
Oh yeah. Sometimes I will pull one of the peer recovery specialists or behavioral health into the appointment with me.
Okay.
It's both, we're supporting the patient, but we're also hitting it from a different angle.
And it's all still peer confidentiality.
Correct.
Right.
It
yeah.
still does not violate HIPAA.
No, what I say is like, in the room, what goes on in the room, we'll give you
It's
that,
private.
get you the help that we can, but I'm not gonna, be down at West Bakery talking about you.
I had
Right.
another question that I knew I was going to forget. I was going to write it down, but I almost forgot. The vans, the transportation, stuff like that, and the peer recovery. What if a patient found a meeting
Mhm.
and they couldn't get there? Could you set up, like, could you bring me, it's at this time? Would River use that peer van to like bring them to a meeting, or?
So if it is during our working hours, we have taken individuals to a meeting. If they are comfortable with us
Mhm.
joining the meeting, some folks haven't gone to a meeting, and so they're really afraid. They don't know what they're about.
Mhm.
We'll join them as well,
That's
because again,
awesome.
in the peer world, we also operate under 42 CFR. So it's
What is that?
So that's the behavioral health and substance use. The federal standard. I can confirm or deny anything. So we can really go into those spaces that other professionals may not be able to. So it's a little more than HIPAA.
So there's mandated reporters is what you're saying, but you wouldn't have to tell on your patient because it's
Mandated
protected?
reporting is a little
That's
different.
different,
That's that if somebody is at risk of harming themselves
Okay.
or someone else. But as a peer, though, we're able to go to those places that are more private.
Okay,
So
so
if
like
they-
AA has a big anonymous blah blah blah,
and we
rules,
follow that
and you're allowed.
anonymity.
Okay,
Yes.
I was like, what does that mean?
Yes.
I'm learning so much today. Going to meetings was really hard for me because I didn't know how.
Right.
If that even makes sense.
Right.
You go onto these websites and you see big book and you're like, the Bible?
Right.
No.
And that's just one example.
No, that's not what the big book is. Even though that's what the big book is. It's not what the big book is.
Right.
And you learn that, but you only learn it by going. And then I didn't go because I was like, I don't want to read the Bible.
Right.
So that's just one example.
Yeah.
Right?
Yeah.
If we get you hooked up with get you in with the dentist.
Mm-hmm.
So it's not, it's all facets
Yeah.
of care.
Especially if you're drinking or using substances to mask a pain of something, self-medicating. I love all this.
Right.
Remind us again when the rally for recovery is in Washington County.
It is Saturday, September 12th. It starts at noon and it's at URI on the quad. And the other great thing about our rally this year is we have a rain location. So if it does happen to rain that day, they have secured Memorial Union for us. So this is a rain or shine event. So please come and join us. We would love to see all of you.
How will we find out if it's moving
There
due to
will
rain, other than looking out our window?
Campus.
We will have people directing folks to there. We'll have signs for that.
That's so
But
cool.
yeah, no, we're looking forward to this great
A
event.
day like this, as opposed to a
Right.
day like yesterday.
All right. I love that. Thank you so much, ladies.
Oh,
It
you're
was
welcome.
a pleasure to meet you.
Thank you.
Then we're going to take a quick break and we'll be back after this with some more guests.
I'm Ryan Collins. I'm the clinic director, specialized orthopedic physical therapy. Every time you come in, you work one-on-one with the physical therapist, personalized one-on-one care with that person. Working with Wood River is very beneficial because we have great relationships with all the doctors. Do not hesitate to give us a call, come in for an evaluation, or talk to your doctor, and they can refer you to physical therapy.
Lickety splits where the summer sticks on our fingers, on our lips.
2 scoops high in a waffle twist.
We're living it up at Lickety Splits. Lickety Splits, take your flavor pick. Rainbow swirl or classic mix.
Big wide smiles and a sugar blitz.
Yeah, everyday sweet at Lickety Splits. Hey!
At the Ocean Community YMCA, community means showing up across 4 branches and 2 summer camps, all rooted in one shared mission. Every day we bring people together to grow stronger in spirit, mind, and body. From fitness floors to youth programs, from lifelong friendships to unforgettable summer memories. No matter your age or stage of life, there's a place for you here to belong, to thrive, and to be supported. This is the place where everyone belongs. This is the Ocean Community YMCA.
Saturday, August 22nd at 1 p.m., join the Smoke and Barbecue competition at Tavern on 3, 809 Nooseneck Hill Road, West Greenwich, benefiting Veterans, Inc. Come hungry and ready to enjoy barbecue, 2 live bands, raffles, and family fun for just $35. Think you have the best barbecue around? Enter the competition for just $25. Call 401-255-6673 to register by August 15th.
If you want a sweet treat or a bite to eat, if you're shopping for the week or a great piece of meat, there's only one place to go. Meet me at Dunn's Corners Market. Meet me at Dunn's Corners Market. If you're here for the weekend or you're here for a lifetime, meet me at Dunn's Corners Market.
Wood River Health provides medical, dental, and behavioral health care to over 10,000 people a year, even when they can't afford to pay for the care they need. The cost of providing healthcare services has increased, and the grant funding we receive doesn't fully cover the cost of patient care. We, like other community health centers across the country, count on community support to keep our doors open. With your help, we can keep serving as a safety net for your neighbors. Will you help us invest in our mission?
Liar.
This I just made.
This just in, Ken Collins lied to me.
Oh no.
Because he said he came here just for me, and turns out he's going to the dentist. I think I just violated HIPAA. So we did miss something, and it's something that's really important to me. Preventative care and harm reduction. It's called Kodak. It's a mobile medical unit, and it's starting on site, meaning right here in mid-August.
Yes.
All right.
So-
Tell us, what is Kodak?
So for those who may be familiar with methadone maintenance clinics, Kodak has been in the area, Providence area, and they have a location in Wakefield for many years now. And they have a third mobile van now. And what that means is they're able to get out into communities that may have some other barriers or that they're not able to put up a brick and mortar. So here in Hope Valley, in our parking lot, starting in a few weeks, we're going to be having the Kodak van here Monday through Saturday, 6 a.m. to 10 a.m. And they will be able to offer that medicated assisted therapy option to folks, because here at Wood River Health we offer MAT as well, which is, I'm glad I'm back because we did not talk about that. So here at Wood River Health we offer MAT for alcohol use disorder and opioid use disorder.
That's
So-
medically assisted
treatment.
Yes.
And there's no shame with that. That's no different than if you take a high blood pressure medication, or if you're diabetic and you're taking your insulin.
Yep.
To receive the benefits of MAT. There are so many things that helps someone to regain back in their life and their dignity and their responsibility and their accountability. So that Kodak van will be here starting mid-August, and that will be an option for folks. And what's great is when I arrive in the morning and my peer arrives in the morning, we're going to be able to stop by and check in with the van as well and offer our support. So we ask you to keep an eye out in a couple of weeks for the van to be in the back of the parking lot.
So to utilize this van, you would already have to have a prescribed method. How does that work?
So they're going to be doing intakes, I believe, on site.
So if you
they
wanna-
have a team of people. So
Okay.
if folks are interested in exploring that, they can come by and they can speak with
I love that.
with the team that's coming. So they're already going to have a nurse, and they're going to have a counselor, and they're going to have a peer as well, and they have their driver. So they have a whole team that will be coming, and we're just going to offer additional support. And what's great is when folks are here, if they need additional support from Wood River Health, then we're also here for that as well, to get them connected with what they can benefit from.
All right. And yeah, you never imagine that getting off of alcohol or drugs is deadly, but it is.
Correct.
So medical intervention or medication intervention is sometimes very needed. I needed it. I was very sick. I was detoxing from a lot of things. And you just get a little barbiturate and you get through your day. And it was the best part of recovery, because it was finally like, it wasn't just, oh, I could breathe or anything. It was like this literal weight felt lifted. And then I kind of like came out of that little daze after the prescription was done. And it was like a teleport. It was like, it took me from here, hazy, kind of better.
Exactly.
And without it, I don't know, my heart was going crazy. I was shaking. I was sick all the time. I think they saved my life.
They absolutely do. And so that immediate time of having that medical monitoring, that can help with those initial physical withdrawals. But other withdrawal symptoms can last for up to 2 years after one stops a substance. And these other medications, what they do is they help to decrease the cravings, manage some of the triggers. They help someone to develop some of those other coping skills. We certainly encourage folks who choose any MAT to also take part in all the other things that are available to them. So there's counseling, there's peer support, there's support groups, there's getting involved in the community and finding maybe that exercise is great for you, or connecting with your local farmers market so you're getting healthier foods. And those are things that the peer recovery support can help somebody to navigate. And there's no shame in any of that.
The thing about addiction that I've found through my recovery is the addiction was not alcohol. The addiction was not drugs.
Correct.
It could have been freaking apples.
But what the
addiction is the obsession and the need and you will do anything for that thing. It literally could have been apples. It could have been hurting myself. Addictions are everything because they ruin your life because of it. If I was getting arrested for robbing people's apple trees, that is addiction. I could not stop myself from robbing the apple tree. I was on somebody else's property. I stole from them and I got arrested for it. And that made me lose my job. And a big thing you hear about in recovery and in meetings is if you don't stop, there's no other trajectory than you're going to get in trouble. Like you're going to hurt yourself more. And it's true. No matter what your addiction is, it is going to affect your life probably negatively.
Right. And for a lot of folks, the addiction surfaces because we're either trying to avoid something or we're trying to provide relief from something.
Yes.
And again, like you stated,
it's
often what's
the
talked about
addiction.
though is the substance use, but folks are struggling with gambling. They're struggling with shopping addiction. They're struggling with all kinds of other things. And so it is important that we connect them. And another great
One more
aspect,
event,
I'm going to
right?
finish up with another great event. So in Westerly at the Granite Theater on the third Tuesday of every month, we have an great community event called Can We Talk? And this is where it's a community-based, artistically infused, clinically supported program that offers a safe space for sharing and healing. And the best part about it is it's free. And then the next best part about it is we start with a meal. And so we really encourage folks on the third Tuesday of the month at 5:30 p.m. to come and see us at the Granite Theater in Westerly. And please come and see what this is all about. And while you're there, we support one another. There's a time for short sharing. And then there's silence in between to help us just kind of absorb and process and just allow folks to have a safe space to share. So I appreciate having a little extra time this morning. And I am going to pass the torch now over to another smiling face that I love seeing again. So great.
All right.
Thank you all.
Thank you so much. It was
You're
great to
welcome.
meet you. We're going to pivot to Joseph Reddish.
Yeah, or you can call
the
me
third.
Joe. That's
Joe?
fine. Would you like me to move up a seat?
Yeah.
Okay.
I don't bite
Oh, well.
often.
Oh, well, I
You
like
are on the board of directors,
Yep.
and we're all celebrating 50 years of service.
Yes,
are you
indeed.
serving 50 years of service?
I'm actually not serving 50 years of service.
You
but,
didn't look old enough.
Well, thank you. I appreciate it. But I kind of am. I just really, I realized not too long ago, I was actually 16 when Wood River was founded.
Wow.
I'm actually from California. So when I came in the community, I heard about Wood River and the great work they did, which is one of the reasons why I joined the board here. But we are celebrating 50 years,
Very cool.
which is incredible. And we've seen a lot of growth.
And more to come.
A lot more to come. I call it this. What we're doing today is just kind of the pebble in the pond as we continue to kind of ripple through the communities, down to Westerly, throughout the Charho area and things like that. So that's the important part, that we continue to listen and understand our communities so that we can provide the services that are needed.
I love that. We always hear when we talk about Wood River Health, the board. What is the board? What's their responsibility here with Wood River Health? What are their roles? How are they involved with all of this?
Okay, that's a great question. And so the board's responsible. We have a fiduciary responsibility to support the CEO, which is
Okay.
Allison, as you know, to make sure that she has the services and the revenues and the funding, and then to support the staff indirectly. We do not directly interact with the staff as far as the day-to-day operations. That is our CEO's responsibility.
Okay.
But what we do is we act as an advisor and a guide to our CEO, to make sure that we are on the right track, to make sure that we're following, the National Association of Healthcare expectations in the process. We have a very diverse board. And when I say diverse, a lot of different backgrounds, because as you know, running a community health center has a lot of different aspects to it. And so we have somebody with financial background, we have individuals with health background, we have people with management background, we have individuals with marketing backgrounds, et cetera.
It's always good.
It's very good, yes. The other big piece of our board is that we are 51% patient oriented.
So there's a patient majority
Right.
in the board. Is that a rule, or does it just happen to be that way?
It's a guideline that's required,
Okay.
but it's also a good guideline for, I'd say, for any organization to have a board that's made up of what their organization is
It's
responsible
serving,
for.
yeah.
But it also keeps us in tune with the community. And when I say in tune, so if you're a patient here and you're on the board and you see things, you're going to be more apt to
Say there was a problem, you're gonna be like,
Yeah.
no, I just went there and they don't have that. Why don't we have that?
right.
And you can bring it to the attention a lot quicker than hoping that a patient you don't know and doesn't know you and doesn't know how to find you says
and,
something.
and may not be comfortable speaking up.
Fair.
And so that they have ears on the board, is the way I kind of look at it in the process of things.
I love
And
that.
the other thing is I always kind of have that aspect, and I never use the word problem. I use the word challenge,
Challenge.
because a challenge is something that we can always overcome. Yes, we've had our different challenges, but we've always found a solution or overcome those challenges.
Can you think back to like a moment where a majority of the board is patients benefited the program as a whole?
Restate your question as to kind of.
So the majority of the board is patients. Can you think back to a moment in time where that benefited like a decision, or it brought up something that like changed part of the program for the better for the patients?
Well, one of the things that's getting ready to happen, as you know, we're getting ready to build a new
A Tower Street.
well,
right?
Tower Street is one, but our reception area.
Okay.
Okay, it is too small for the size we are now, and it's not as efficient as we'd like to be. So from the individuals who happen to be patients on the board, as well as our front desk receptionist, that shared a lot of information, so it was able to validate that need
I love
to increase, and better our entrance expectations for our patients.
Oh, that's great. And it's great to like see things grow before your eyes.
Right.
It's like blossoming and getting bigger and bigger. Even since when I started this, I don't think you guys had Westerly. And
No.
then,
Yeah.
or not this, but like the
Right.
relationship with
Right.
Wood River.
Right.
I don't think you guys had Westerly. And then you added Westerly and I was like, oh, big deal. Let's talk about it. And then it's like this year, all of a sudden there's a new reception area and Tower Street and so many good things happening, and another van. You have another van
Yes,
all of
the
a
van-
sudden.
the van
We
is
didn't even
huge.
talk about that's a development. They had none, and then they had one. So now they have two or possibly more. I don't know. That's really awesome, and I love to be here for it.
Yeah.
The mission of Wood River is to treat patients no matter what, no matter their ability to pay, and make a community impact. How does the board do that? Do they do fundraisers? Do they?
Well, we partner with our internal team and support any fundraising efforts.
Okay.
The board also has different relationships that we each have with different individuals out in the communities, with the other corporations and things like that. So we leverage our relationships to ensure that Wood River Health Development Department has, the advantage of, when we need sponsors, when we need a van, or, when we need a certain
DJ.
thing. It's a DJ. Yeah. But we leverage those relationships. And that's, I think, having your board from your community It's like having little fingers. Once that pebble drops in the pond, it ripples out, and we're able to, access a lot of different resources, and again, get guidance too. Because sometimes it's best, we have different individuals say, I know somebody that knows somebody. Let me ask them.
Right.
And that provides another strength of decision making, so that we try and make the right decisions.
You spoke about, we have the person that's into marketing, we have the person that's into this. What's your claim to fame?
My claim to fame. Well, my claim to fame is I'm a talker, as you can tell, but I sit on 4 different boards.
Okay.
And I've also worked for different corporations, and so I have a lot of relationships. My background is management.
Okay.
But also have a strong marketing background in the process. But I think probably the biggest thing I can bring is a passion for making a difference. It's ingrained in my family because it's been part of my family. My dad was, when he passed away, was part of 24 different boards out in California as a retired educator.
Did you see him ever?
Well, that would be the question for my mom.
Oh, jeez.
Until he had passed, it was kind of humorous. So my mom says, "Now I understand why your father would leave at 7 a.m. and not get home until 5 p.m."
Yeah,
Because
seriously, that's a long day.
And it's been part of our family culture, even for my grandparents. Being involved in giving back and making a difference. So
That's awesome. What about people who aren't on the board? Like, I'm not on the board. I'm not on any board because I don't think I have the attention span for that. But can I help the board, or what do I do? Like, how do I help the board, help Wood River Health, help Allison?
Well, if you see that we're on a mission of something and you have an idea, one thing is that makes Wood River as strong as it is, we are always open to ideas, suggestions, because we only have 2 sets of eyes each.
Right.
A set of ears each. And the more ears we have listening for opportunities, the more eyes we have looking at, as if we looked over at this bush, you and I would describe that bush differently.
Possibly, yeah.
Okay, because we see it through different lenses. But that's the strength of having a couple people looking at it, and then we could just decide how do we want to design, or how do we want to recreate that bush, or how do we want to shape that bush. And that's really the strength of Wood River, is we have a lot of eyes, we have a lot of ears that help guide us to the best decisions on a day-to-day basis.
I love that. The one thing that makes me feel good about Wood River, because you were saying if you have an idea, my biggest complaint about the I was just talking to them, that's what's on my mind, clinical recovery, was that some places, not Wood River Health, but some places will hear you say, I'm addicted to blank and I need help. And they will say, well, you don't meet the criteria for our program, and you'll be turned away. And that can have tragic results, life-ending results. Yeah. And it's always bothered me, like, you're not using substances enough to get help. You're not, drunk enough. You're not high enough to get help. And it's like, but high at all, drunk at all, or fearful that you will. Say you're trying to get clean and sober, and you're so scared that you're going to relapse. So you go seek help, and they're like, well, you don't meet the criteria for us to help you. Here, there's so many outlets and so much integration. You will always find help for anything you need help with. And I imagine, as a community health center that was put together by the actual community, that had something to do with it. So I thank you guys.
Oh, you're most welcome.
I heard there's a gala.
We do have our 50th anniversary gala coming up, which is exciting.
Let's talk about that. What is it? How is it?
Well, it's going to be at the Dunes Club.
Yes.
And we have a lot of great sponsors and supporters of that, but it's really to celebrate 50 years of growth, transition, increased integration into the community. We welcome anybody to, come to the gala. Go to the Wood River Health Services website, and you can, sign up to be part of it. We also, for businesses that are out there that would like to make a difference and have an effect with a one-time opportunity, they can donate to Wood River to celebrate 50 years, because
Nice.
everything they donate, as you remember, what comes into Wood River goes out to the whole community. And so really, we have some great opportunities for businesses to integrate. For community members, it's a great time to find out more about Wood River Health.
Okay.
As we continue to grow, expand, understand our services, and to your point of, we don't turn anybody away per se. We look at everybody as human, and if we don't have the right service or support here, we're going to guide you to that. We're not going to just leave you sitting out floating in a boat. We're going to find a guiding beacon there where that you can reach that destination that gets you the right support and help. So
Nice. So the gala is September 18th.
Yep.
And tickets are on the website?
on the website, yes,
All
they
right.
are.
Do we know how much they are?
They are $150.
Not bad. And I assume that's a meal.
That's a meal. It's dancing. It's music. It's exciting. We have a silent auction, which has some incredible things. And I
Those
believe
are always really, really good.
And we'll probably may have a live auction on a couple items. So,
Do you have an
see.
auctioneer?
I believe if we have the silent or the live auction, we'll have an auctioneer. Yeah.
Oh man, I just like listening to them. I don't know.
Yeah. That rumble, that
She's an
that
8. She's 9.
rhythm.
She's a 10. I know. Very cool. Formal wear, I assume.
Well,
get all dolled up.
You get dolled up, get pretty, but I always say dress to make sure that you feel like you're comfortable in who you are.
I just miss back in the day, you always saw people going to the movies, they get all dressed up.
Right. Yeah.
Going to a show, you get all dressed up. We don't do that anymore. I have very little eyeliner on today. I mean, I miss getting all dolled up with nowhere to go.
Well, I had to take a little time to make sure I got my
Oh, I
makeup
can tell.
before I got here.
I can
so,
tell.
yeah.
You are glowing,
and I had
sir.
to do my hair. It took a little bit longer.
Yeah. How do you get through it? Honestly.
It's tough. It's tough.
Are there any other events you want to mention or?
Well, I think just the gala is as I say, is a one-time giving event, but on a day-to-day basis, it's important that we don't forget that Wood River is open 365 days a year. And for those individuals who have the ability to make a difference, we always encourage them to, give when they can. We have opportunities for donations throughout the year in the process of things. And so business support, community support, partnerships are critical, especially these days with the fact that we don't have as much funding from other sources at this point in time. But our commitment is still to our community and making sure that we provide the best services and the most efficient services we can.
It's kind of
with
like
what
just
we have.
because you lose your income doesn't mean the bills change.
Exactly.
So the programming has not changed. The income has, but the show must go on.
The show must go on, and people and health is important, and it's important.
And it's
that
always
we
going to
take
get
care-
bigger.
We got to take care of our community, because if we're not a healthy community together, we're not a healthy community.
That's fair. That's fair. Anything you want to say to people out there?
I would just say, no matter what you do on a day-to-day basis, and I always say this anytime I speak, we can all make a difference. We can all save a life each day. And I always share that smiling at a stranger, saying hi to a stranger, because we don't know where each other are at
100%.
at any given time. So we need to acknowledge each other, give value to each other, and say hello to a stranger, because that might be that smile that makes a difference and gives
Or just that moment that you break them out of their thought
Right.
and they're like, whoa, what? Like, I am seen. Maybe they feel unseen. I've given myself permission to compliment people. So like, I love your luscious hair. Yes.
And you'd be surprised how people's brightness.
They
is,
are shocked, surprised. Sometimes like they jump. Like I'll be like, oh my gosh, I love your nails. I mean, I'm not lying. If I don't
Right.
like your nails, I'm not going to tell you I like your nails. But just giving myself permission to notice the little things and mention it.
Yeah.
And people will like jump out of their their metronome of life.
Yes.
So
So,
I thank you so much for being here.
well, thank you for having me.
All
Appreciate
right.
it. Okay, very good.
Then we're going to take a break and we'll be back after this.
I've been cooking since I was 12 or 13 years old. I was cooking in the Navy. And honestly, we were welcomed kind of with open arms into the community. We've had a reputation for having great beverages and okay food. And I want people to know that that is the thing we're attacking first, is making sure that our food matches our beverages. I want to make a really strong lunch menu. If you had a breakfast sandwich yesterday, come back tomorrow, it'll be better, because we're changing the way we do things around here. I'm JJ Glode. I'm the owner of Higher Grounds and Lickety Splits, and we'd love to see you come in soon.
Hi, I'm Chris Kozłowski, owner of Broadview Florist and Garden Center in Dunn's Corners. For over 40 years, our family-owned business has been your go-to destination for beautiful, custom-made floral arrangements. Whether it's a special event or just to brighten up your day, we create highest quality designs tailored just for you. Trust Broadview Florists to make every moment unforgettable. Visit us today or give us a call at 401-322-0390.
Are you looking for a fresh cut in Westerly? Step into Rio's Barber Shop in Granite Plaza. Whether it's a classic trim or a trendy new look, we've got you covered. Experience the perfect cut for every age and style in a friendly and relaxed atmosphere. At Rio's, it's not just a haircut, it's an experience. Visit Rio's Barber Shop in the Granite Plaza in Westerly or give us a call to schedule your appointment at 401-315-2208. Your style, our craft, Rio's Barber Shop.
You may not be able to tell from the outside, but cars are more complicated than ever on the inside. That's why you need to take your car to a place where the technicians really know what they're doing. Our experts have been repairing cars for almost 60 years. From simple brake jobs to complex transmissions. There's nothing the experts at AMCO haven't seen or fixed. That's why we know cars inside and out. AA MCO.
Ah, that was me. Good morning. It is 9:28. We're right on time, which I am not used to at all. But here we are. I'm here with Dr. Tiffany Waldick, Chief Dental Officer.
Yes. Good
All
morning.
right. Does that mean you're the teeth police?
I essentially, yes.
Tell me what that means. Chief Dental Officer.
So I head the dental department here at Wood River. I provide both clinical care, general dentistry, and I supervise the dental staff, both clinical and administrative.
So it's a very easy job.
Oh yeah, super simple.
Yeah, super. Oral health. I'm nervous just talking to you. Do you see this?
Oh no!
This is a thing. I'm like,
we're dentists. We're not scary. I swear.
It was actually you weren't out here. You were probably like doing your job. But I was talking about how doing this gig, blah blah blah. I met the dentists that work here and stuff like that, and it was actually you guys that made me. Even though I don't come here, I have a dentist that I hadn't seen in decades at that point. But it kind of like took the sharp edge off of being so scared of seeing the dentist, because I'm like, I should probably really actually do that. And it was comforting just to talk to you guys, which I really appreciated. So close to my heart, even though you're not my doctor, I appreciate you. And you've done something for even my mental health, which shows the integration that Wood River possesses.
Yeah, I think that's something that a lot of people don't necessarily think about when they think about teeth and gums. You know, they think oral health is just brushing and flossing, and that's important. But there's so many other components to oral health. It has such a huge impact on our overall health, our social and emotional well-being. It's really a critical component of overall health.
I actually, so we'll get personal here. I'd have my throat cauterized because I have ulcers. You think ulcers are in your stomach?
Right.
Just in your digestive tract, right? Newsflash. Your digestive tract is from here to here. Like it is the whole thing. So the inside of your mouth, the inside of your throat is the same as the inside of your stomach stuff, blah, blah, blah. So, that was hell.
Sorry.
But I went to my dentist and he missed the first time. I might switch dentists. I was mad about it. But why is, speaking of, because now we're talking about ulcers and digestive issues, right? So it kind of proves it, but I'm still going to ask the question, why is oral health essential to overall?
So the mouth has never left the body, even though we often treat it that way. And a lot of the oral health or oral diseases that are inflammation related impact not just the oral cavity, but can impact can cause heart disease, can contribute to worsening diabetes, respiratory illnesses. As more research is done, we're learning more and more that oral health is critical to maintaining health in all of these other body systems.
Crazy.
Yeah.
That's wild. I does that make your job harder?
It does, but I also think it makes it more rewarding. When personal story, when I was trying to decide what I wanted to do for a career, I knew I wanted to pursue healthcare. I was pretty sure I wanted to pursue dentistry. I had a roommate who was pre-med say to me, dentists are doctors who can't hack it in med school. And so I was offended by that naturally. And I selected a dental school that was very heavy in teaching medicine, not just oral medicine, whole body medicine. And I've taken that little chip on my shoulder with me to make sure that when I'm looking at my patient, I'm not just looking at their mouth, right? I'm considering,
hacking it.
right.
I'm totally hacking
it. I'm considering, their emotional well-being. Are they even in a place to be thinking about, okay, we're going to do this filling today, or are they having more of a critical need, an emotional need that needs to be met first? We screen our patients for anxiety, depression, substance use. And from those screenings in the dental department, we're able to link patients to our behavioral health services when they're needed. If a patient's in an active crisis, quite frankly,
They probably don't want a filling.
right. And but they may be presenting because they feel an obligation to keep that appointment, and we appreciate that. But we need to meet the patient where they are in that moment and take care of what's going to be best for them. The filling can wait, right? We can bring them back for that. Let's get them taken care of emotionally. Or if there's a health need, we screen, we check our patients' A1Cs, right? So if a patient presents with diagnosis of diabetes, we're looking into their health record and we're seeing, okay, when was your last medical visit? When was the last time you had your A1C checked? And what was the value? Does it show us that things are well controlled, or maybe we need to be doing a little bit better? And we're helping link those patients back to their primary care provider if they've fallen out of sync with their appointments.
Is there a connection between, so I know my dad had diabetes, so I checked his feet every day. And his skin was getting thinner, stuff like that. Is there an oral aspect to diabetes?
Oh, yes.
Oh, man.
Yes.
And it's not just sugar makes cavities?
No, it's not just sugar makes cavities. It's actually inflammation related. So a lot of the inflammatory markers of gum disease. So we're talking about periodontal disease. So bone loss, gingivitis, periodontitis. I'm
so glad they didn't write that down for me to say. I'm like pterodactylitis. I don't know.
But these conditions are, it's an inflammation-based disease. Okay. And those same inflammatory markers are what cause blood sugar control to be worsened. Okay. So if a patient has really high blood sugar, they're likely going to have a higher risk of gum disease. If that patient has gum disease, they're going to have a higher risk of poor blood sugar control. It can be a cycle unless we break that cycle through dental treatment. So by having cleanings, or in some cases deep cleanings, if there's a lot of buildup, we can actually improve a patient's blood sugar control, roughly the equivalent of 1 to 2 medications that they may be able to avoid by having that treatment. It's very impactful.
All right. Do you have any openings today?
We may.
That's wild. Sorry, I'm absorbing.
Of course.
So that would be almost preventative, not only for your teeth, but if you're pre-diabetic or blah, 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 don't even get to the medications.
Right.
Just nip it in the bud or the molar. I don't know. Wow. Yes. I do remember when my dad got sick with something, his diabetes was worse. So that makes a lot of sense. And I don't know why that surprised me so much. But yeah, because I think diabetes, foot care.
Right. And that's important.
Yeah. But everything.
Yes.
Everything.
It's all connected.
All right. How long have you been in the dental field?
So I actually just celebrated my 15-year anniversary here at Wood River this week.
Congratulations.
Thank
Happy
you.
anniversary.
Thank you. And I've been doing it a little bit longer than that, but we don't ask people their age, right? No, but just shy of 2 decades.
I mean, you don't look old enough to work here, but it's fine.
Thank you.
So touching on diabetes, but like preventative dental services, does that just mean cavities and inflammation?
No. So when we talk prevention, a lot of what we're talking about is education.
Okay.
It's screening. So basic prevention in dentistry would be coming in to see your dentist, your hygienist, having x-rays and a clinical exam, an oral cancer screening.
What if you don't smoke?
Even if you don't smoke, there are other causes of oral cancer. So for
Okay.
example, one major cause of esophageal cancer is HPV, human papillomavirus, which is a virus that most people are exposed to when they are fairly young.
Yeah.
And it's interesting that you brought that up, because one of the ways that we try to integrate with our primary care team is by screening patients, checking their health records to see have they had their HPV vaccine. We start administering that vaccine roughly around age 10. Before they've likely had an exposure. And that's hugely valuable in preventing oral cancer in the future.
So I know the research on HPV is fairly new considering all of us. So we've kind of missed it. All of like
Right.
everybody here today, I think, has missed it. We've that ship has sailed. It's in the Pacific. You can't get the vaccine after a certain age, right?
Usually once there's been an exposure, there's less value to having that vaccine. So we really target now, yes, the younger age group. With that said, though, having regular routine screenings with your dentist, with your primary care, allows us to potentially identify if we see a lesion early. And obviously, preventing something from occurring entirely is obviously the objective, but prevention can also mean catching things incredibly early so that they don't have as negative consequences.
That's fair.
So, so having those screenings, when we see patients, both the dentist and the hygienist are performing those screenings. So having multiple sets of eyes on things, having cleanings for kiddos, we're doing sealants. These are other types of prevention that we're completing, fluoride treatments. Lots of really wonderful, very simple and very cost-effective things that can be done to prevent a whole host of problems later that tend to be more expensive, a little more aggressive, and just generally, less well tolerated.
So what happens if somebody comes here and they don't have insurance, but they still they've never been to the dentist, or it's been decades or whatever? Like, obviously that's a need that needs to be met, but like, how do they pay if they don't have insurance? Because dental work is wild sometimes.
It's a good question. And you're right. That tends to be a barrier that many patients, many residents in our community face. We do a number of things to help patients offset costs. So you don't have to have dental insurance to be a patient at Wood River in any of our departments, but including dental. If a patient doesn't have insurance but wants to pursue it, we have navigators who help them kind of navigate the health insurance space to
Everybody
find the
says
correct plan.
navigators, and I grew up in Norwich, so we had the Norwich navigators, and I just think of this big crocodile is going to meet me at the door, and the fact that probably doesn't happen is almost disappointing.
I'll take it back to the team.
Yeah,
We'll see what I can do.
Go buy Where's Mr. Reddish? We need a big. Never mind.
So that's one way that we help. Another thing that we offer here is what's called our sliding fee discount. That is based on a person's income and family size. That kind of categorizes them potentially into a discount category where they may receive 20, 40, 60, 80% off of their treatment, or perhaps even have what's called a nominal fee, which is just a flat rate per appointment fee. And then lastly, if a patient has some care and they're struggling to keep up with their bills, we do offer payment plans as well. We do not turn away anyone based on ability to pay, especially for emergent care. Like we're going to see you and work through that, and then we'll figure out the rest.
Do you guys do orthodontics too?
We don't do orthodontics. We screen for orthodontics, and we have wonderful community partners that we work with to provide that service.
Do they have kind of the same mission where it's affordable, or?
Many do. So a number of the offices that we refer to accept very similar insurances. Generally, not every office accepts all of the insurances we take, because we accept so many.
Like football squares,
exactly.
Like, where do you fit?
But yes, we have some wonderful partners who kind of help to bridge the gaps for all of the patients who either have insurance or if they don't have insurance.
The gaps. I'm talking about braces. Sorry. ADD. Woo. That's awesome. What about like oral health disparities?
So unfortunately, it's still very much a reality that there are differences in the healthcare system based on race, based on gender, based on, affluence. There's a lot of barriers that natural ones and ones that are sometimes put up in the
societal.
Exactly. And honestly, it's been Wood River's mission for 5 decades to kind of break down those barriers or figure out ways around them so that we can create equity for all of our patients. In our area in particular, a lot of our patients are faced with transportation challenges.
We got a van.
We do. We have 2. So that's been, one thing that we've recently implemented to try and help patients reach their healthcare providers, particularly for patients who live in Westerly, right? There isn't public transit out of Westerly to this area. But we also have a very large geographic area that we see. We're seeing patients Exeter, West Greenwich, Charahoe, Hopkinton, Richmond, Westerly, Southeastern Connecticut. It's a very large space. So to be able to help, break down that barrier at least a little bit, or help link patients to, if they have the Rhode Island Medicaid insurance, the state's transportation broker, just trying to make that process easier to at least remove that one barrier, right? The financial barrier we kind of talked about, we've got a number of ways that we try to help with that as well. And then all of our staff are trained on, various other barriers like diversity and inclusion, trying to make sure that we are providing a meaningful and safe care experience, not just physically safe, but emotionally safe for all of our staff, all of our patients, and making sure that
Our staff.
Them too. I mean, they need a safe space too.
I remember going to some doctor's offices and there's like signs highlighted on the wall that say like, "Don't yell at our staff."
I think it's a good rule. Just maybe don't yell at anybody, right?
Don't yell at
Like,
anybody. Just don't yell.
We can just, we can just talk.
But yeah, I don't think I know of these disparities. Like I was trying to think like, other than like, if you're less affluent, if you have less money, like, do you even deserve straight teeth? Like, oh, I can't do this, I can't do that, because like, who goes to the dentist when you have money? I'm like, you have to.
It's tough when patients are faced with, okay, let's say it's a family, we have one car, right?
Okay.
And significant other needs that car to get to work.
Okay, so now it's
So
transportation.
so it can come to that. Or maybe it's, I can't afford to take a day out of work to take care of myself, because not going into work means less money to provide for my family. And then there's a cost of care, right? So
Right. Are there many like gender issues in dentistry? Like, are racial, or?
I think there certainly can be. I mean, I think the research has shown that, especially based on race, that we see certain ethnic groups, certain races being accessing the healthcare system less. And I say that not that they're necessarily choosing to access it
Right, it's
less,
just
but that
how
there are
it-
systemic barriers that kind of prevent them from being able to access it less. With
I
res-
always love like spreading awareness about stuff like that, but at the same time, I hate learning it, because I'm like, oh, it sucks to think you didn't think of that.
Right.
But I do love learning about it, because I want to know how I can help bridge that, or be the advocate for you deserve this too.
Right.
Or
And I think that's what's so wonderful about a facility like ours, right? Where we've got multiple different healthcare departments, we've got supporting services, is that a patient may enter Wood River in one area. And if we've got them like through the door, we can figure out how to help them access everything else. And then we can do our community outreach to try and, get to populations perhaps that are either unaware of us or don't think that our services would be available to them. It's beautiful to work for an organization that's very community minded.
Yeah.
And to have the resources to be able to care for that patient in a whole person way. I respect my private practice colleagues quite a bit because it's much more challenging to do that in their settings, right? They're not able to just call up their patient's PCP up the hallway and say like, hey, we have this mutual patient and I think we need to talk about XYZ. It's a little bit harder to navigate that. So it's a blessing to be able to work with these other teams and to be able to offer patients such robust wraparound services.
I imagine, like, I'm thinking about it now as far as, because like that, they gave me a few talking points. So the disparities, that I didn't come up with that by myself, I'll be honest. And I'm thinking about it now, like depression is probably a patient you see all the time of, I don't really take care of my teeth, because how do you brush your teeth when you stay in bed?
Right.
How do you brush your teeth when you can't go get the new toothbrush? You have bacteria building on that toothbrush. You're not even thinking about it because who cares? I've been there, and it just dawned on me that is a hurdle of oral care, because you have to maintain most of your oral care outside of the dentist office. I mean, we're talking about maybe once a year, twice a year. What's a typical schedule?
Twice a year is pretty common. When we compare, it's maybe 2 hours a year, if unless a patient needs some additional care. But for the average patient, maybe
Like the
2 to
cleaning,
3,
right?
2 to 3 hours.
So then, like,
versus,
the
other
of, 10 months of the year, you're doing it all by yourself.
Right. It's a team effort, but it's largely patient driven. And we spend a lot of time on, we call them self-management goals. So first figuring out, like, where is the patient at in terms of what they're doing? What gaps in knowledge can we help kind of fill? Because quite often that's a barrier as well. I can't tell you. I can't tell you how many patients will say to me, wow, I've actually never been told how to brush my teeth or how to floss my teeth.
Let's go over it. Is it up and down? Is it left and right? Is it around in circles?
So what you should be doing is angling your toothbrush at the gum line, maybe about 45 degrees, right? Yep. So you're kind of getting the tips of the bristles right to and slightly under the gum line. And then either short vibrate, like almost like you're vibrating the toothbrush back and
get
forth.
a vibrating toothbrush.
Yep, that works too. But if you're doing it manual, you can do slightly short back and forth. You want to use gentle pressure. You don't want to scrub really hard. You can also use small circles. Either is fine. About 2 to 3 teeth kind of at a time, and then sweep down. So you're almost getting all of the ick toward like the biting surface. And that will help to better clear all of the plaque and the food debris that get lodged along the gum line.
The most interesting dental fact I've ever learned. Because sugar creates cavities, right? Wrong. Bacteria creates cavities. And the reason why you don't pick up your baby's pacifier and stick it in their mouth is you have bacteria in your mouth that you're now transferring to their mouth, and they don't even have teeth yet, most likely, or they have milk teeth, which have they're much softer than adult teeth. So you're actually introducing rot to their mouth that they can't even handle yet, blah, blah, blah. But also sharing drinks, sharing anything that goes in your mouth, biting on pens. If it was in somebody else's mouth, you're sharing their bacteria, and that can also cause cavities when you never had it before. Making out. So it's like you have to be cautious of your partners and yours overall health, because it ultimately affects yours too. The whole sugar doesn't necessarily create cavities. It just harbors, or it makes an atmosphere for bacteria to grow.
Yeah, it's one piece of the equation, right? So yeah, the bacteria. So like we talk about sharing pacifiers, we don't recommend that because it introduces that bacteria to the baby's mouth. Now, if they never had sugar in their diet and they never drank anything acidic, Would they get cavities? Probably pretty low risk, but that's not the reality of human experience, right?
Right. Well, my cousin
eat
fell
foods
when
that
he was a
have
baby and chipped his teeth a little, so he ended up getting cavities because it was like not protecting
Right.
itself anymore.
So it's a multifaceted, multifactorial disease. So is sugar, watching what you eat in terms of sugar consumption, is that important? Yes. Is it the whole story? Absolutely not.
No. I never understood that before
Yeah.
though, and that was a wild fact for me. I was like, whoa, that's
right.
Wow.
And even when we talk about sugar, like sometimes people will think, oh gosh, like I'm gonna have my iced coffee, right?
I don't use sugar. I just use milk. Guess what milk has in
Milk,
it?
right. But also like, okay, well, how quickly are you having that coffee? Are you sipping on it for 4 hours or are you drinking it in 30 minutes? The same amount of sugar in 30 minutes does less damage than that amount in 4 hours.
Because really, I should brush my teeth after this. It's not only acidic; it has sugar in it.
Yeah, but basically, it's frequency, right? It's about frequency of exposure. Sugars, acids, they create an acidic environment in the mouth. That's what kind of helps tip the scales toward tooth decay.
Right.
And so if your mouth never has a chance to recover, because as soon as it starts to, we take another sip of that sugary or acidic
Brush my
coffee
teeth
or
and have
whatever.
my morning coffee. Leave me alone.
Wait 30 minutes. Drink your coffee, rinse out with some water, wait 30 minutes, then brush. You should be in good shape.
Okay. So speaking of Wood River's 50th year, 50 years of improving oral health, what does that look like?
Well,
or we can even talk in the last 15 years, since that's your personal experience.
I mean, we've done some amazing things. In my 15 years, even before that, really focusing on increasing access a number of different ways. We've increased our physical space, right? So we've added additional dental treatment rooms. We've grown our staff to meet the needs of our community. We've added a second site on Block Island. Talk about unique barriers
a really cool
and
reason
access.
to go to
Right.
Block Island and be like, yeah, I'm going to get a cleaning.
But yes, we added, a second site there. We've added a portable dental program. So
What is that?
So
What is that?
So we actually have portable dental equipment that we can take on the road to provide care. And that's one of the ways that we are providing preventive services in Westerly currently. We also bring that equipment to various Head Starts in our area and treat the kiddos right where they are in school. It's fantastic. That equipment has allowed us to improve access and break down some of those barriers we talked about. It's pretty incredible. We were very fortunate to have some wonderful grant funding to help subsidize that so that we could meet that need. And we're continuing to grow that program.
That's really cool. If somebody organized it, would you guys be open to helping homeless individuals with that?
Absolutely. I mean, that is one of the primary purposes of that type of equipment
that's
is
really,
to
really
meet
cool.
individuals where it's needed, right? And those who have the most difficulty accessing care. Where the model of care was designed initially was largely out in the Midwest, the West, where some of these states that are very large, people have really difficulty accessing care because
When your state is bigger than some countries.
Right. But we found that
That's
it
not
works.
Rhode Island, but
No, but we found that it works on large scale and small scale. And while our barriers may be different in terms of the distance to a health center, you brought up homelessness. That's a factor regardless of what state you live in. The
if
reality
you're
is that
trying to
there's
figure out where you're sleeping, or how you're surviving tonight, you're probably not booking your biannual cleaning.
Right. Yeah.
Which is another disparate. That's
Mhm.
crazy. I've expanded my horizons of the whole deal, all of it. I really love that you guys are integrated. I really love that you even have time to think or have the capability by having so many people involved to be like, but what about this? Be like, I didn't know that.
Right.
Thanks
Yeah.
for sharing.
And that's another huge thing that we've focused on is integration with primary care, integration with behavioral health. that whole person care is just so important. And as we look to the future, the next 50, we're looking at ways that we can continue to grow our program to meet our community's needs, whether that's, physically growing in terms of space and staffing, whether that's introducing, new services that we perhaps don't currently provide, or just coming up with creative ways to deliver care in, the most meaningful places.
I really always like those things that you chew after you brush, and then it shows you like where you missed.
Yes,
Those are my favorite.
disclosing tablets.
Yeah. And I also feel a whole lot of shame sometimes. Like,
Hey, the fact that
but
you're
they taste
even
good.
using
They taste really good. I like the way they taste. Oh, why do I do this? Ben, why do you hire me? No, thank you so much. Do you have any events that you want to showcase or updates, or are you hiring? What's going on with
in our dental department?
Yeah.
So we are not currently hiring, but we.
So do you guys face burnout as well?
Sure.
Or-
I mean, I think that's a reality of any healthcare.
Any caretaker.
Really,
Even
yes.
if you're not in healthcare,
Yes.
if you're taking care of somebody who has an illness of any sort,
Mhm.
or even just your children, being a caretaker is you probably are not worrying about your biannual cleaning.
Right. Because you're worrying about somebody else's.
You're worrying about somebody else's.
Yes. We're very fortunate that much of the dental team has been with the organization, some longer than I have, some
Nice.
as long as I have. We do have some who joined us within the last few years, but we've got a really great mix of staff with kind of different tenures. And even though burnout is a reality that we have to try to overcome on a regular basis, we've got such a great team who all work really well together and enjoy being with each other and love the mission of what we do, right? Like the work is meaningful to them, which is what keeps all of us here. So we're very fortunate, I guess, to not be hiring, but I do hope to be hiring soon because I want to continue to grow our program to keep meeting the needs. So
That's fair. And as more people realize they can visit Block Island, we might need more staff out there. That is it's such a cop out, guys, but it's so awesome. I kind of want to go to Block Island. That is awesome. And it also increases the access there because
well, that's exactly that.
people live out there as much as people don't
Yes.
think you live out there. People live out there. So,
Yeah.
I mean,
There's about 1,000 residents or so who live there year round.
Year-round.
And can you imagine having to
Ship your
get
food
on a
in?
ferry or a plane to get to your dental provider?
It would
I mean,
never happen.
how
It's
often is
not
that
gonna
happening,
happen.
right? I mean, for some, yes, they might be committed or they might kind of tack it on to a different trip to the
I'd
mainland.
be on Temu buying those pics. Like, I got it myself. I'm not getting on a ferry.
But unfortunately, I mean, that was the reality that, when we were approached by Block Island Health Services for a potential partnership,
Genius.
we were very open to it
Yeah.
because the mission alignment was obviously there, because mentally to try and imagine some of those barriers, we recognized that there was great need. And so we're very fortunate to have partnered with them, and we've been there now. This is our third year, and it's been fantastic, and the patients have been wonderful. We've been really well received by those patients, and they're
great.
getting really great care. So it's been a win-win for sure.
That's awesome. Well, it's been a pleasure. I'm here with Dr. Tiffany Waldeck, and if you want to meet her too, come on down to Hopkinton Wood River Health.
Thank you so much.
Thank you so much. Ben, we're going to take a break, and we'll be right back.
Wood River Health provides medical, dental, and behavioral health care to over 10,000 people a year, even when they can't afford to pay for the care they need. The cost of providing healthcare services has increased, and the grant funding we receive doesn't fully cover the cost of patient care. We, like other community health centers across the country, count on community support to keep our doors open. With your help, we can keep serving as a safety net for your neighbors. Will you help us invest in our mission?
I'm Ryan Collins. I'm the clinic director in specialized orthopedic physical therapy. Every time you come in, you work one-on-one with the physical therapist. Personalized one-on-one care with that person. Working with Wood River is very beneficial because we have great relationships with all the doctors. Do not hesitate to give us a call, come in for an evaluation, or talk to your doctor, and they can refer you to physical therapy.
What's going on, everybody? It's Patrick down here at the Wireless Zone at 224 Post Road, Dunn's Corners. And this weekend, the new iPhone is here and we have them all in stock. Come get the brand new orange iPhone 17 Pro or the brand new razor thin iPhone Air. The best part is trading your old iPhone and get up to $1,100 off, meaning you get the brand new iPhone for free. But this weekend, you can get the brand new iPad and Series 11 Apple Watch for free. It's all happening down here at the Wireless Zone at 224 Post Road, Dunn's Corners. Don't delay, stop in today.
At Lathrop Insurance, our core values guide everything we do. Because insurance is more than a policy, it is a promise. We care. We treat every client like family. We're solutions driven. We find answers, not excuses. We utilize teamwork. We do what we say because integrity matters, always. And we're always growing. We strive to be better today than we were yesterday. These values have shaped 86 years of service to Rhode Island families and businesses.
321 is about so much more than sports. We're about community, family, small businesses, nonprofits, and sharing stories that deserve to be heard. 321, what's your story?
Good morning. We are back here at Wood River Health in Hopkinton. It's 10 o'clock, top of the hour, and it is beautiful out. I'm having a great time. I'm probably, can we like double this so that I don't have to actually go to work?
Yeah, just stay here and talk to people.
I'm here with Peter Marino,
Good morning.
the CEO of Neighborhood Health Plan of RI.
Yes, good morning. How are you?
I'm good. Is there a neighborhood health plan of anywhere else?
No, there isn't. Neighborhood Health Plan of Rhode Island is unique, and it is one of the top Medicaid plans in the country.
The land of off air is a lot more interesting than on air, I promise you. There were choice words that the FCC would not let me be about. But I was just saying, I really want to just move to Rhode Island so I can get healthcare because you make it so easy, don't you?
Yeah, we work really hard to make sure that people have access to care. And so we actually have 1 in 5 Rhode Islanders are insured by Neighborhood Health Plan. And being a regional small health plan, we have to behave differently than the large corporate ones. We work very closely with our community health centers to make that happen. And we're very fortunate. Rhode Island is very fortunate. We have some of the best health centers in the country. And Wood River is a great example of being top of its class. They really do a terrific job, and they make sure that members, when they walk through the door, they feel welcome. There's a smile that greets them when they walk through the door. Nothing's better than that.
I know. Everybody today, I was just thinking, it has a smile. Some people I've heard are not morning people, but yet they're making my day. So I don't see the problem. I heard Dana's not a morning person.
She's not.
But she's like
She's
like
not a
the
morning
most
person. Yes.
like, good morning. I bought all this stuff here. You want breakfast? Here, I have coffee. Like, how are you not a morning person? Is she more wild at night? Because that's insane.
No comment.
No comment. Okay. So they've been out.
Good answer.
How important is keeping a symbiotic relationship with health centers to Neighborhood Health Plan? Like,
Well, there's a little history here, actually. So Neighborhood was created a little over 30 years ago by the hands of the community health centers.
There we are
So
then.
a little over 30 years ago, the health centers got together, looked at what the landscape of health insurance was going to look like, and said, we need a local health plan because we want to have our own seat at the table to make sure we can influence how things happen. So this relationship has been a symbiotic relationship for over 30 years. And right now, out of our 200,000 members, half go to a health center for their primary care, and me included. I go to a health center for my primary care. And so there's a connection. We know that there's high quality. We know that they pay attention to what the needs of the member are, not just health needs, but other socioeconomic needs. And Wood River Health, as an example, really connects with the member every time they walk through the door to make sure that they're receiving not just high quality health care, but their other needs are being taken care of as well.
I'm assuming that's why they probably need like a bigger reception area, because lines can get a little chaotic if you're actually taking the time to say, hey, how are you? And also, I'm interested in your response.
Yes. You were mentioning earlier the parking lot when you got here was empty, and now it's practically full. So we've got folks coming in for primary care, dental care, the lab, physical therapy. So it fills up. So that is, we're hoping to start that project off in the fall.
I love that. Do you think there's a significance in having insurance in the outcome of somebody's health?
Oh, I absolutely believe that's the case. I think when you have insurance, if you're not feeling right, you're more likely to go see the doctor and say, hey, there's something not right here. Let me check it out. You're more likely to get your annual checkups. You're more likely to get your vaccinations. When you don't have health insurance, you're going to put things off longer, which means that that ailment could get worse. And then you end up in an emergency room. And so you're dealing with something that's more of an issue at that moment. And you're also folks who don't have insurance, it's likely an economic choice. And so they're also choosing between health insurance and food or heat. And so if they have families, food and heat are going to come first in the most immediate need. So it is critical that people seek coverage. And there are lots of different ways people can get coverage through Medicaid, through the exchange, obviously through their hopefully through their work. But our number one job is trying to make sure people stay covered, because that opens up so many doors for families and making sure they stay healthy.
And that's just one barrier. Are there more?
Well, there's a number of barriers. Economic barrier is one. 2 is just not understanding the process. And then 3, with the
That's me.
with the federal actions that have taken place over the last year and a half, really constraining the ability of people to remain eligible for Medicaid in particular. I think that is going to put a lot of strain. We're right now somewhere around 3.5% uninsured in Rhode Island. With those changes, we expect to get close to 10% again, and that's a lot of folks. And so
That's
we're
almost
working.
That's more than triple.
It's more than triple. We've done a lot of great work with our health center partners to really reduce the uninsured rate in this state, especially for children. And we're at risk of getting back to where we were 15 years ago, and that's not a good place to be, because folks having insurance makes sure that we all stay healthier. And when you're healthy, things work out for you in terms of employment, making sure that you can keep a steady job,
Right.
and other things that make your life a lot easier. So it's really important.
How do you not get discouraged? Like,
Well, I think you have the answer. You've met a number of great providers this morning, and not one of them is pessimistic. They're all optimistic. They know that there's more that can be done. But whether you're talking to a provider who's providing healthcare or dental care or mental health services, they all believe that they're providing great care, because they are. But more importantly, they know that they can do more. And so that what keeps me motivated. And I have been on more than one occasion, been at a place where somebody says, "Oh, you're at Neighborhood Health Plan? I love my health insurance." How many people on this planet say, "I love my health insurance"?
I don't think
And
I've ever said that in my life.
I have heard it multiple times. And if I have time, I'd love to tell you a story.
Go for it.
So I was
Hit me.
appointed CEO in 2014. So my kids were roughly 8, 9 years old. And about a month in, I went to go see their primary care doc with my kids to get their regular checkup. And the nurse was talking to us, and my son was nudging me saying, "Hey, look, there's a poster of Neighborhood on the wall." And she noticed, she goes, "Oh yeah, Neighborhood." She goes, "Neighborhood's awesome." And the reason is because when I have to take care of a child, I can do whatever's necessary to take care of the child. It's like wrapping a child with a warm blanket. That's how she described it. I'm like, this is awesome. So I came back to the office and I described it to our marketing director. And she's like, "You have to tell that story." So we did, and we gave every employee a blanket with the story saying, "This is why you're getting a blanket." But the story doesn't end there. And this is why I'm still at Neighborhood. So about a month after we gave the blankets, a major northeaster winter storm was coming through. And so we had the idea, let's see how many blankets we can get back to give out to homeless and those who need it. We got every blanket back, and we got over 75 volunteers to give them out during the storm. So to me, that's Neighborhood, and that's the Community Health Center partnership. We couldn't do that work without them. So that's why I'm here.
Beautiful.
That's why I'm optimistic.
All right. Are there any future health equity initiatives happening right now, or?
Sure, there are a number of. First of all, health equity is core to what we do, and we partner with the health centers to make that happen. So we have a lot of great initiatives with our health center partners. A couple examples are we've been really focusing on maternal health.
Okay.
The data has cleared that Black women have a significant gap in the level of care that they receive compared to white women when they're going with their when they're pregnant, and we think we can make a difference in that work. So we're working with our doulas, we're working with partners with Women and Infants, Care New England proper, as well as our health centers, to make sure that women know they have access to great care. So we're optimistic that we're going to close that gap, but it's going to take hard work, as an example. Another one is we have an asthma program to try to encourage folks to address it early so that they're not showing up in the emergency room. And we've done a lot of things to support families with asthma as well. So there's a couple of examples that are really exciting.
That is
And
exciting.
we're really fortunate to have terrific partners like Wood River Health.
How does that integrate into a place like Wood River Health, like the support for community-based health organizations?
Well, I think the bottom line is this is where it happens. We talked
These are
about
the
the parking
doulas.
lot. These are the folks who get it done, and you can see when folks are coming in here, you can tell that they felt like they were taken well care of, that their needs are being thoroughly vetted so they can see what they can do to help. We were just talking about the SOC initiative that Allison has been driving here.
SOC?
Yeah. People loved and need socks, believe it or not. It is an important piece.
Sock-assuming.
So let me pass this over to Allison.
Let's talk about socks.
Sure. Well, we had a local business just down the street in Richmond, the Preserve. They did a sock drive. And then they identified a few nonprofit organizations to donate the socks to. We also do in the wintertime, we have a mitten tree because folks need hats and mittens and gloves, and kids
My
sometimes
mom-
lose their hats and
Yeah,
mittens
my
and
mom used to
gloves.
be a aide on the public school buses and stuff,
Mhm.
and the amount of well, she's retired now, it doesn't matter. They weren't allowed to get the kids gifts for obvious reasons.
Sure.
But she couldn't not. She saw all these kids freezing, put their hands down their pants, trying to stay warm in the winter, and so she went. Go away.
I know the
She
flies
went
really like
out,
us right now. Yeah.
and got all of her students that she transported a hat, mittens, and scarf.
Yes, that's
And
great.
some of them were so appreciative. She was like, it was unrealistic
Yeah.
how appreciative they were.
Yeah.
And it made
Yeah.
her feel good, but at
Yeah.
the same time, very sad
Yeah.
that was even a moment in their life and happy. It was just,
Yeah.
it was just a
Mixed
juxtaposition
emotions.
of
Yeah.
happy and sad at the same time.
Yeah, exactly. Yeah, we're very lucky. We have a lot of local businesses, statewide businesses like Neighborhood that support us very generously, and the local community as well.
That's awesome. So is Wood River currently doing anything to collect socks? I'm assuming brand new socks in the package.
So right now we're looking towards the holidays. We'll be here before we know it.
Stuff your
And
stocking with socks?
well, we usually do a food drive.
Okay.
We do have the sort of the mitten tree in the lobby, so socks certainly, but mittens, scarves, gloves. I mean, if you're out at Kohl's or wherever you shop and you want to pick up an extra one and just stick it on the tree, and then we have patients that come in and need that, so they just take it off the tree. And then at the holidays, we've been collecting gift cards that we then give to our patients, because some of our patients we talked about earlier that have struggle with transportation or food insecurity, and then we give those out to patients as well.
It's very cool. Very cool.
So I'd like to add that there's a couple of really big initiatives that are happening over the next couple of months that are in line with what Allison was talking about. So there's a back to school program where we distribute over 16,000 backpacks with school supplies to children that are in need. So that's an exciting one. There's 12 locations across the state on August 15th that will be giving those out. We also are very engaged in what's called Warm Hands, Warm Hearts, where we purchase jackets, winter coats, hats, gloves, scarves, and we work with the Providence Community Health Center and others, as an example, to give those out. And there's never enough, as you can imagine. We always run out before the line is done.
If we have any knitters out there.
Oh, the knitters, yes. My mom does that
Crocheters,
actually,
yeah.
and gives it to the local hospital. So there's a lot out there that we partner with to make sure that there's resources that might not have otherwise been available to folks. And there's never enough. But the generosity of the staff at the health centers like Wood River Health and at Neighborhood really knows no bounds, and very proud of it.
That's very awesome. Does that have the Warm Hands, Warm Heart, does that have an actual date, or is it
Yes.
an ongoing initiative that is just always open?
There's collections throughout the year, but it's sometime in late January-ish.
Okay.
And the
Keep an eye out for
back
that.
to school program with the backpacks is actually coming up on August 15th.
August 15th. I love that. Do we have any locations locally here that we can shout out?
So the Johnny Cake Center in Westerly
Yep.
does do a back to school day. I think it's a different day than the 15th. I think it's the following weekend.
Oh, yeah, they're two different, right? Because I've done both of them in one year before, and I was very confused. I was,
Yes.
What's happening? Where am I going?
Yes.
Both are phenomenal.
Yes.
The August 15th one, is this the one?
So
at the
that's the one that's statewide,
Yep.
and
At the Armory?
Yes, there's one at the
Okay.
the Westerly Armory.
I think so, but I'm
Okay.
not 100%
Okay.
sure.
Well, there's a
not gonna-
website Back to
there's a
School
site.
has its own website, and so all of that would be available there.
Yeah, and it's awesome. And there's like
It's fun. They make it
local
fun. They have
artists
food and
that, like, make,
games and
pencil cases. I got a really cool one. I still have it. And book bags and school supplies. And it's back to the first day of school was always my favorite. I stopped going after that, but school supplies. You know, you get all your new stuff, new backpack, notepads, and you're all ready to go. You know, after the first few weeks, it's not fun anymore. I'm kidding. Go to school, stay in school. You'll end up like me. But yeah, I think it's really important because when thinking about blockades or accessibility, when you're struggling to put food on the table or afford rent, how it's so hard to think, oh, you want I don't know, Dora the Explorer backpack, you want a pink, but just take this black one, please go to school. No, they have pink and purple and blue and gold and silver.
Lots
They
of
have so many
options.
colors
Lots of
and
options.
uniqueness that it's not just a bag or no bag, or you know, maybe you'll find a lunchbox too, school supplies, because spending money on stuff like that, it doesn't happen with, you know, you have food stamps.
Yeah.
You can't get that stuff, but the kids need that stuff. So I really appreciate events like that. It's really cool.
Yeah.
Are you going to the gala?
I am absolutely going to the gala. It's a 50th anniversary gala. Neighborhood is a sponsor of the gala, and we are excited about celebrating with Wood River Health.
I'm going to put people on the spot now.
Oh,
You're
you,
like,
sh-
"You're
you
going to the gala,
should.
right?"
You should. So my wife is coming with me, as a matter of fact, and we have a really good presence from the neighborhood team. And it's always a great time. The auctions and the fundraising is really important, and making sure that we can provide those additional resources to it. And I've made a specific donation to the gala.
Oh, yes.
I'm also a novelist, so a book that I've written is also part of the bidding. So I encourage folks bid often so that you can make sure you get a copy of my book.
Do you have an author name, or is it Peter Marino?
It is Peter Marino, and I have a co-author. His name is Tim Diaz, and the book is The Kingfisher and the Crow. And we will donate more books if that means it can raise more money for Wood River Health. So I'm happy to do so.
I challenge the community.
Autographed copies.
Autographed copies.
Autographed.
I want his
Yes.
hand to freaking hurt. I want him to have to come to Wood River Health to get physical therapy because he signed so many dang books.
If it raises money for Wood River Health, I'm all in.
You got that, right?
yes,
This is recorded.
it is.
So
It's
next
recorded.
year, dunk booth.
Oh, well, you do that already.
Yes. Oh
you?
my goodness. Look at you trying to put me in a dunk booth. All right. So we, neighborhood is got a great partnership with ALS Rhode Island. So they do terrific work to support families who are struggling with significant challenges. Right. And so we do that at neighborhood, and we make it a full day event. And we raised the most we've ever raised this year. We raised almost $19,000 from just from employees at neighborhood. And one of the
For the ability to dunk
well, that's portion of it. There was a long line to dunk the CEO for certain.
you. It's 18,999.
And so, yes, I spend a lot of time in the dunk tank, but others do volunteer because there's others who people want to dunk as well.
Add a lot of ice.
And we also do bucket challenges, and there's baskets and things such as folks can bid on to try to win through raffles. And it's just for a great event. So you can see the
When's
neighborhood.
that? When's the next
It's
one of those?
every summer, so it'll be next July. So you've missed this
missed
year's,
it?
yes, because I'm sure you look like you want to dunk me. I can see it in your
And
eyes.
I was a pitcher. I got you.
Oh, yeah. We tried to field a softball team, but there's a lot of weak spaghetti arms at neighborhood. So I didn't go in the dunk tank as often as I should have. But
And that's why we never won a game. No I'm kidding. That's awesome. Allison.
Yes.
He is the CEO of Neighborhood Health Plan. You're the CEO of Wood River Health.
Yes.
He goes in a dunk tank.
Oh no, I knew we were going to go in this direction. Don't give them ideas.
Come on.
But-
Would you?
I would donate.
Would you?
I would think about it. I would think about it. You know, I do spend a lot of time on my hair. So,
too.
Yeah.
What if I got you a gift certificate for your hair?
Okay, maybe we can
Okay,
talk about
okay.
it. We'll talk about it.
Dana,
But
take this down.
switching topics.
Okay, fine.
I think I mentioned when we were talking earlier about both the primary care crisis as well as the upcoming changes to the Medicaid program. And neighborhood's been focused very heavily on specifically trying to get the word out to Medicaid patients about the changes that are coming. So maybe Pete could just say a couple words about that.
Yeah, I didn't want to put anyone on the spot, but you're the pro, you're the professional. So what are we looking forward to? Good, bad, and ugly.
Okay, so first of all,
Let's end with good.
Well, we'll end with good. But so first of all, with the administration's changes at the federal level, they have made it much more difficult for people to get through the eligibility process. And so it's incumbent on the state and its partners, such as Neighborhood, Wood River Health, and others, to work with individuals so they can get through the eligibility process. So they're going to require more frequent checks on eligibility than they have in the past. So
Eligibility meaning your household income, who lives in your house.
Got to check your income, got to check your assets, and they're going to do that twice a year for a good portion of the people who are on Medicaid.
Before, wasn't it good for like a few years?
Every year you had to go through the
Okay.
process. Okay. So that's one. Two, they're going to also make it more difficult for folks who have different immigration status. So they're making it very hard for immigrants to remain eligible and to be eligible. So if your status is questionable, it's going to be very difficult to continue to remain eligible for Medicaid. So we expect in Rhode Island to have tens of thousands of people lose their eligibility under Medicaid. We're talking 20, 30, maybe even 40,000 Rhode Islanders. That's significant. We started our discussion earlier when we first came on the air that, you know, we're worried about keeping people covered. Well, this is the most immediate threat to keeping people covered.
Yeah.
And so these folks are going to have to go through a process. So I guess my message to everybody who's listening is if you are on Medicaid, make sure you check your mail because the state will be mailing information to you saying you need to follow this process to remain eligible. If you're not sure, call. You can call
Can
the
they
state.
just come here with their mail and
They
be like, help me?
They can.
Some of the
They have-
navigators, that would be a job for them,
Exactly.
right?
The navigators here on site can help people work through that process. But the most important thing is do what's necessary to keep your eligibility. Get it done because that gives you access to all the great care we've been talking about all morning.
Right.
So.
Okay. And say somebody was one of those who somehow they let something lapse, they lost coverage. They can still come here and pay a very nominal fee to get treated and simultaneously work with a navigator to get back on track, correct?
Yes, so I'll pass this to Allison, but that's the beauty of the health centers is they welcome everybody who walks through the door, regardless of their ability to pay. And I think that's what makes them different than other provider groups across the state. You walk through this door, they're going to greet you regardless. And we want them covered, but if they're not, Allison's team is ready to take care of them.
That's right. Because things change, and sometimes, you know, people lead busy, complicated lives. They didn't open their mail, or they missed the mail, or they thought it was junk mail and they tossed it. So they show up at the front desk thinking they have this insurance when they may not.
Yeah.
So that's the point at which we can say, okay, well, let's get you into your appointment today.
Yeah.
And then
don't worry
let's
about it.
get you in with a navigator and help you fill out the paperwork for either to get you back on the coverage you had before or help you apply for that sliding fee scale program or the nominal fee.
That's pretty cool. I appreciate that.
So you asked about thinking about something positive. So when we think about the resources that are available in Rhode Island, so Neighborhood Health Plan has been here for over 30 years, and it's one of the top rated Medicaid plans in the country. There's an organization called NCQA, which rates all the plans across the country, and we've been rated one of the top plans in the last 22 years straight.
Nice.
And that doesn't happen by accident. That happens with great partnerships with the community health centers, which we have some that are getting significant recognition for their performance. And I'll let Allison perhaps maybe sneak a little, give it. Yeah, you should do it again. You'll do it again. But
Is there anything in recent bills or anything that would help get somebody covered that maybe before wasn't eligible to get covered? Is there any positive in that sense of?
Well, I think one of the actions that the General Assembly recently took, Rhode Island's General Assembly, was when they recognized that the federal government was not able to take action to extend what's called the enhanced premium tax credits. This is for people who are on the health exchange.
Okay.
Most people refer to it as Obamacare.
Okay.
Okay,
That's
so-
you go to the state website and
Yes.
open enrollment, blah, blah, blah.
Exactly. So they weren't able to do it for this year, but next year there is state money to help provide some level of tax credit for Rhode Islanders that is not there now because the federal government allowed that to lapse. So I give the General Assembly a great deal of credit for saying we're going to find resources to get this done, and they put it in the budget. So 2027, there's going to be additional monies that are available to give tax credits to Rhode Islanders who weren't eligible before. That's going to help bring people back into health
See, that's
insurance.
what I wanted, something that was
That's-
like legal mumbo jumbo, but like that was it.
Yeah,
That's
the bottom line is we're going to see more people come back that lose their insurance this year. They're
Mhm.
going to be able to come back.
There's a
because
reason
there's a
to.
reason, yes.
So you're gonna
So
get
that's
that tax
terrific
credit.
news, and they should all take a bow for that one. They deserve it.
It's fantastic. Yes.
Yeah, so we mentioned earlier in the 8 o'clock one, in case people weren't morning people, right? Like we said, and you slept in a little bit, you might have
looks more
missed.
alive today,
You might have
right
missed the news that yesterday the federal government released its rankings of community health centers, the 1,400 across the U.S., and the quality and how we perform in terms of quality of care. And for the 4th year in a row, we received the Gold Quality Award, which is the highest award you can get and is only given to 10% of all the community health centers in the U.S. There's 3 community health centers in Rhode Island that received that Gold Quality ranking, which is really great. 3 out of 8,
Right.
which, like Pete said, helps neighborhood to remain one of the top ranked Medicaid managed care organizations for the past 22 years.
Is it 10% because that's all that qualify, or do they try to get this award to the top 10%?
That's a good question, and I don't know the answer, so I'm not going to make it up.
Okay. You make it up. No, I'm kidding. That I'm gonna.
It might be
I'm
a
gonna
little of both.
research
It might
that
be a little
bit
of both.
because
Yes.
if it's only 10%, I don't know, which one do you think is worse? I think it's worse if only 10% qualify,
Right.
versus they're trying to get.
I
the
think there's a
top
certain
10%.
threshold, and
Yeah, there's a
whoever is above
threshold,
that
and which ones
threshold
are the best.
Yes.
Yeah,
There's silver and bronze
congratulations.
awards as well. Yes, first rank.
Does that make up 100%, or do people not get any award?
Yes, the
People
latter.
don't get.
There are some folks that don't get any of the. That doesn't mean they're providing poor quality care.
it's
I think that some of the standards we're held to are higher standards than other folks are held to, and it's hard, right? When you're talking about communities where they, like we talked about, access to transportation, they can't get in to see the doctor. If you can't get here, then we can't help you get your physical or get your vaccination or get referred for your mammogram. So we've got our van in the parking lot. We have a larger sort of a mini bus that's out and about today because we have a small grant that on Tuesdays we drive the minibus to a few of the housing communities, low-income housing communities that are local, and we just run a little route, and we take them to the grocery store, to the pharmacy, wherever they need to go, and it just runs that
Not
route
just medical,
all day
just
on Tuesday.
life in general.
That's right. That's
Love
right.
that. I have a business out in East Hartford, and one of my customers needs to get to the shop somehow to get his car. And he was like, I made an appointment, and then they found out it wasn't a doctor's appointment, and they said I couldn't use them. And I told them, my car's at the doctor. I was like, oh.
Yes. There is a Medicaid transportation benefit, but sometimes we have to fill in the gaps for folks.
Yeah, that's pretty cool. In the last, well, you haven't been here for 50 years, but in your,
I personally have not.
in
no.
your time at
On the
Wood River,
planet,
though,
yes.
the expansions you've seen, you don't have to give up any secrets, but in the coming 50 years, is there anything that you guys are like actively like have your eyes on, like a big development for not just Tower Street, but like, I'm sure before you had the vans, it's like now we have transport. That's huge.
Yes.
Before you had, maybe behavioral health, that was huge
Yes.
asset. Is there any further developments, or have you got it all?
I wouldn't say, we have it all. Our focus is primary care, integrated behavioral health, dental care. What we'd like to do is, I think, just do more of what we're doing well, right? So maybe adding staff so we can see more patients in the dental clinic or in primary care. We'd love to someday open a dental clinic in Westerly. like we have here. We don't have an equivalent of here in Westerly. We have some portable dental equipment. Dr. Waldeck
That
may
is
have talked
so
a little bit
cool,
about
by
that,
the way.
and can do pretty much everything that, not everything, but can do a lot. And so we do see some patients in Westerly with the portable equipment, but we know there's a need in Westerly, both for kids and adults, in particular Medicaid beneficiaries. So that's the future plan.
All right. I love that. Wow, that was perfect timing, folks.
Goes by fast.
All right. Any wrap-ups anything you want to say before we wrap up and go to break?
I think I would wrap up with this, is that oftentimes in my travels, other states, other leaders ask, what is it about Rhode Island that makes it work? Why are we so successful in being able to deliver the quality care throughout the state? And I would say it's the secret sauce is clear. It's the people who are dedicated to the mission, both here at the health centers and at neighborhood. And it takes great leadership. And we're fortunate here at Wood River Health that Allison is at the helm. She's visionary, and she knows that we have a lot to do to take care of folks, but she drives resources to make sure it happens. So we're very fortunate to have that kind of leadership throughout the state, but here in Wood River Health, Allison's doing a terrific job.
I agree. All right, folks, we're going to take a break and we'll be back after this.
I'm Dale Sold, the owner of Shoreline Painting and Cabinet Refinishing. My vision for the company has always been to elevate paint contracting. When you call, you get a live person. Typically, we have estimates out the same day. We have really good communication with our customers daily. We make sure you're completely happy before we leave the project. We service residential and commercial customers. The commercial work we do is typically more community-oriented. We just completed a expansion of our shop. We added 3 more spray booths to allow us to increase capacity. You can find us at 77 Stillman Ave in Pawcatuck. You can find us on our website at shorelinepaintingri.com, or you can call the office 401-834-1684 to book an estimate.
Hi, I'm AJ Trust. And I'm Jeff Swiderski with AnnieMac Home Mortgages Momentum Group, your trusted partner in the home buying process.
At AnnieMac, we can strengthen your offer with our innovative program, Cash to Keys, giving you a competitive edge by allowing you to make a cash offer on your new home.
Together, we've helped over 1,000 families move into their dream homes, and we'd love to do the same for you.
Give us a call today at 401-486-0853 to get started.
Oh, let's go down to Toscanos. Men shop downtown Westerly, where style and class go hand in hand. You can look your best and dress to please. Buy the right shoe, get the left one free. And if Paulie makes fun of you, you get an even bigger discount too. Toscano's men's shop since 1911.
Lickety splits where the summer sticks, on our fingers, on our lips.
2 scoops high in a waffle twist.
We're living it up at Lickety Splits. Lickety Splits, take your flavor pick. Rainbow swirl or classic mix.
Big wide smiles and a sugar blitz.
Yeah, everyday sweet at Lickety Splits. Hey!
Hi, I'm Neil Anthus, owner of Sound Financial Partners. We're a full-service financial planning practice dedicated to optimizing your investment, tax, and cash flow strategies. As fiduciaries, we always keep our advisory clients' best interests in mind when making recommendations. Whether you're preparing for retirement or growing your business, we're here to help you achieve your financial goals. Ready to start your journey to financial success? Visit us at our Westerly office or give us a call at 401-642-4333.
Good morning. We are back here at Wood River Health in Hope Valley, and I have the honor of being with Elena Nicolella. Nicolella.
Thank you.
There's a lot of L's. CEO of Rhode Island Health Center Association. Let's start off with the obvious. What's your favorite color?
Blue.
Just kidding. What is the Rhode Island Health Center Association?
Sure. Well, thanks very much for having me on. It's a pleasure to be here during National Health Center Week. And the Rhode Island Health Center Association is an organization that supports the 8 community health centers in Rhode Island, of which Wood River Health is one. So we've got community health centers across the entire state serving every community in the state. Our job at the association is to advocate on behalf of Wood River and the other health centers. So we go to the state house and we advocate for better regulations, better reimbursement rates. And then we also work with all of the health centers so that they can learn from each other. So we bring the chief medical officers together. We bring the chief financial officers together. So we do a lot of technical assistance to the health centers.
So you're trying to get better and better bills passed.
Exactly.
That's
yes.
a hard job.
It is.
That's a ridiculously stressful job, probably.
I think what we're really trying to do at the state house is ensure that the legislators really understand the very unique and special role of community health centers in the state. You know, we're not hospitals, we're not private primary care practices, we're not like any other health organization. Like you said, we serve the entire community. It's whether you have insurance or you don't have insurance, whatever your income is, we're here for everyone.
So was National Health Center Week the result of something you guys did? Is it more the board?
National Health Center Week is a national recognition. So there's a National Association of Community Health Centers,
Okay.
and they put this National Health Center Week concept forth, I think probably about 60 years ago. And
Wow.
it's a time for every community health center across the country to highlight the very important special work that they do.
And it's so deserved.
Yeah.
It's very,
yeah.
very deserved. I'm wondering about the role of health centers across Rhode Island. In the last 50 years, the role has grown substantially. Do you see that continuing, getting bigger, staying where it is? If it ain't broke, don't fix it? Or
I think we are on the cliff of a very, very big change to community health centers, really as a result of decisions made at the federal level to limit who can access the Medicaid program. So the recent legislation that was passed, referred to as One Big Beautiful Bill Act or HR 1, part of that law was to say, if you are an adult and you don't have children over the age of 13, the only way you should, and you don't have a disability, the only way that you should be able to access government funded healthcare coverage like Medicaid is if you are working. So I think the law didn't recognize that the majority of people are already working.
Did they then make it easier to get on disability?
No.
Or no? Okay,
No.
so we just didn't add anything to the other side of that. Like,
Because I think the real goal is to make the Medicaid program smaller. So the intent is to limit the ability for people to access the program, which in turn is going to make things very challenging for most health centers. I think Wood River will be less impacted because they serve a wide range of people with
It almost
lots of
doesn't
different
matter what
coverage.
happens on a federal level because they're going to see you
Exactly.
anyway. They're
Yeah.
going to give you that sliding scale anyway. They're going to fundraise. They're going
Exactly.
to. That's the one thing that, in my mind, makes the community health center stand out against anybody else is you don't see a doctor's office fundraising.
Right.
What do they? I don't even know if that's legal. But a nonprofit organization who's helping mitigate costs of healthcare, absolutely you have to fundraise because that's the cornerstone of everything you work hard for. And with policy issues affecting health centers.
Yeah, and definitely fundraising we'll probably see a lot more of. The other strategy that I see coming out of Wood River a lot is partnerships.
Okay.
Partnerships with other community-based organizations, partnerships
Like the neighborhood.
Yes,
the
neighborhood
insurance,
health plan
neighborhood
of
health
Rhode
plan.
Island, but also working with the school department, working with community mental health organizations like Gateway and Kodak. So that's a big part of Wood River Health is this openness to collaboration and partnership, which I think is going to serve them well.
I think it's cool too. Like if you go to an event that's not necessarily Wood River Health's event, it's not necessarily anybody's event, you'll always see Wood River Health 10, Neighborhood Center or Neighborhood of Rhode Island Health. I can never get that out of my mouth.
Neighborhood.
The
They like
insurance
to be
people
called neighborhood, yeah.
Neighborhood. You'll see RICAN. You'll see the lady at the library who helps you get food. You'll see all these people who you know because of what they contribute to the community, and it almost like makes this area in particular feel more like home. Rhode Island, Westerly, Pawcatuck area, Hopkinton, this area feels more like home than my home state, I have to
Yeah.
say, and it makes me very wanderlusty. I want to come out here. I want to live here. I in a spot where I can't afford to move, but like it's just like so alluring to it draws you.
Yeah.
And I think that's the big thing about Rhode Island. For some reason, it has this captive audience of once you visit here, once you experience what it's like to be a Rhode Islander, you want to be part of this. I wish I could bring my mom everywhere I go because when she talks about Rhode Island, she's blown away. She's like, they're always fundraising. They fundraising for everything. If you got a kid and he scraped his knee, they fundraise. And I'm like, okay, mom. But she's just like, where we're from and where I grew up, if you fundraise, you get robbed.
Oh,
Yeah, you're going to
okay.
get robbed. If you have a bucket of money on a table, you're going to be a victim of a crime. Like you don't do that. So to see Rhode Island fundraise and come together and have galas and sell tickets and have a community theater and have a community health center event at the community theater
Yeah.
and all of that, and to have such a preventative maintenance, preventative healthcare, and harm reduction, all community centered is wild for my family, for me to see, and it just I want to be part of it so bad.
No, I think you're touching on something that I probably spoke to Joe Reddish about quite a bit. I think one of the other components that makes community health centers different is they're run by these boards, and a lot of the people on the board are patients.
All right.
So the patients say, we don't like the way this is working, you know, you need to change this process. And they're the people are making the decisions about the health center. I think it makes a big difference.
Huge difference.
Yeah.
I too often see corporate make decisions for their franchisees and stuff like that are so tone deaf it hurts. Like, you don't do this every day. You have no idea what this is like, but they do. They know what it's like to go in and be like, you know, all the receptionists want to ask like blah 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 blah, and I'm waiting in line and I gotta go. I have to go to work.
Yeah.
So here we are. Make a bigger reception area.
Right.
Give people space. And then touching on, I have anxiety. I don't like being in an area that's too small. Make a bigger space. It's just like input like that really makes a difference. And seeing your health center, your doctor's office expand, renovate, do well
Yeah.
gives you this inner peace of I'm in the right spot.
Yeah.
As far as efforts for advocacy supporting health centers, anything that we should be looking for in, I don't know if we can talk about upcoming votes or in the news, or give me something.
Yeah, at the federal level, the laws that I just talked about passing, they passed about a year ago, and now we're getting ready for implementation. So people who are currently eligible for Medicaid or who need to apply for Medicaid, they're going to start seeing letters saying you need to make sure your contact information is accurate. And over the next few months, the state of Rhode Island will be issuing guidance about here's how you document whether or not you have a job. Here's beginning next year, here are the ways that the Medicaid program will change. Here's how you have to document if you're going to school, if you're volunteering.
Does going to school count as a job?
It does.
Okay, that's
so
good.
The requirement will be 80 hours a month, and it can be a mixture of work hours, volunteer hours, and school hours.
Could you be a full-time volunteer?
You could, yeah.
Okay.
You can meet the hour requirement in any of those three ways or in a combination of those three ways.
Okay.
I think the challenge that some of us who are not at the state see, it's not, it's going to be more about documenting than it is actually
It's the
doing.
processes. So I suffer from ADHD. It's so hard for me to go through processes.
Yes,
processing is literally my disability.
Yeah.
So that all sounds very, very scary to me.
Exactly. I think it's scary for a
every
lot
time
of
we bring it
people.
up, I'm like, my mouth is dry. I get anxiety because I'm like, I'm never gonna do this. I'm just gonna be uninsured forever.
The positive thing, though, is places like Wood River Health have people that we call navigators, and that is their job. And we are working with the health centers. We at the association are working with the health centers to find ways to increase the number of people who are available, like
right,
actual human beings, to help explain what the process is and go through that. The state is also figuring out how to fully support people. It's going to be very difficult and challenging, but I think we're lucky. We've got the health centers. State wants to do their best. So just have to make sure we have a good way of identifying where the issues are so we can tackle them quickly.
I think this is a monumental moment in time where you have to look at your local politics and just have faith in your local politics and be a part and talk to your representatives and really make the change here, because it's going to be us that makes the change for our individual stage, which was President Trump's entire campaign, if you think about it. So if we meet him where he's at, taking what we've learned today, let's meet him where he's at. He wants every state to be, I don't know what he wants, but that was a big part of his campaign. And that's just fact, is every state is kind of like, no, I don't want to say on their own, because that wasn't the message. It was in control of their own state.
Yeah,
So if
I
we
agree.
take control of our own state, that's honestly the best we can do right now.
Yeah.
There's no way around it. That's the best we can do. That's where our focus needs to be. And I think that while it seems a little detached, that's a positive, because we know Rhode Island and we know that our voice usually matters here.
Yeah.
So
no,
I don't see
agree.
a huge problem versus like Texas, where does one voice ever get heard? That it's bigger than some countries.
Yeah.
Like that's
Yeah.
insane.
Yeah.
So I think it's a lot easier, and we're really, really fortunate to be here in Rhode Island. And I think I take that as a positive.
I do. And I have to say the state agencies who are responsible for implementing these changes, they are taking it very seriously. They are taking compliance with the law very seriously, but they also want to make sure if a person is appropriately eligible for programs, they should be able to access them.
Absolutely. To end on a really, really positive note, did the Rhode Island Health Center Association have any contributions to this 50th celebration? What are we doing there?
Yes, we are happy to contribute and support to all of the health centers, but we are sponsors of the gala, and we're attending all the events, and we couldn't be happier.
You're gonna go to the gala?
I am.
That's very cool. It's in September. September 18th. Very cool. Have we had a gala before? Have you guys had a gala before?
Yes.
All right.
We started doing it, well, COVID kind of interrupted some things. but
Yeah, that's why I'm like, I
in
don't.
fall of 21.
Okay.
Yes, that's right. The fall of 21.
All right. What's your favorite part about the gala?
When it's over.
Okay.
It's a lot of work.
I know.
But people have a lot of fun, and the band is great. The band is a lot.
Do we know? Are we announcing who the?
Bridge.
Oh, I love them.
And they are fun. Oh my god. And they really get the crowd going.
Yeah, that's going to be a fantastic night. They're very high energy. They read a room. I don't know if they ever really follow a set list or if they're just reading the room and like, you want to do this? Okay. And you can tell a lot of my Weirdsterly is coming out. The sister station to this is local artists and local music. And so, yeah, I'm like, take it to the bridge. They're so good. You're going to have an amazing time. What's your favorite part of the gala?
I love the music. I love the food. I love the. Are you doing the silent auction again?
Have you ever won anything?
I did win something. I forget what. I think it was a wine basket. Yeah.
Oh, worth it.
Yes.
You win wine. Go to the gala. All right. Closing words.
Congratulations to Wood River Health on their 50th anniversary.
Happy 50th.
Yay.
Woo! All right. It's an honor to be here. I'm DJ Gadget, and this has been our health center week. Do we have more stuff for the community? I know we have a staff picnic. That's not the
so
community,
most
but
of what we're doing the rest of the week is just really kind of acknowledging the staff and thanking them. So we have fun things planned. We're very food motivated.
Yeah.
So we have a coffee truck coming. We have a staff picnic. In the fall, we do have something for the community that we are doing. It's the weekend after the gala, the following Saturday. There's like a fall fest.
Okay.
I think it's in Richmond, in the center of town there, and we'll have more details about that. As details develop.
keep it tuned here to learn more about the community events surrounding you. And thank you so much for having me.
Thank you.
Wood River Health provides medical, dental, and behavioral health care to over 10,000 people a year, even when they can't afford to pay for the care they need. The cost of providing healthcare services has increased, and the grant funding we receive doesn't fully cover the cost of patient care. We, like other community health centers across the country, count on community support to keep our doors open. With your help, we can keep serving as a safety net for your neighbors. Will you help us invest in our mission?